So good afternoon, everybody. I appreciate everybody's patience. I understand that a few members were doing a media event on an opening with Congressman Panetta, and so this meeting should start pretty soon. Thanks for your patience.
We're so rushed. We're all here. Okay. Hello, everybody. It is Wednesday. I have the wrong date on my agenda. Okay. It is Wednesday, April 7th, 2021. It is 1:38, and we are going to call to order the Monterey County Board of Supervisors. Can we get a roll call by the clerk, please?
Good afternoon. Let the record reflect all supervisors are present, with Supervisor Adams, Alejo, and Lopez appearing via video conference, and Supervisor Root Askew and Phillips appearing in person.
Lovely. Are there any additions and corrections this afternoon?
There are no additions and corrections.
Okay. I'd like to welcome our Spanish interpretation. Jocelyn Martinez. Would you like to announce our Spanish interpretation services that are available today?
Jocelyn Martínez, intérprete de español. Se les anuncia que hay interpretación disponible en vivo vía Zoom. Al pie de su pantalla, si selecciona el icono del mundo y presiona el lenguaje español, tendrá acceso. En estos momentos, este servicio no está disponible para aquellos que llaman a la Junta. Gracias.
Fabulous. We're going to welcome Lisa Griffin Burns today to lead us in the Pledge of Allegiance. Lisa Griffin Burns joined the board of the Community Homeless Solutions in April of 2019, where she supports CHS's work to serve the most vulnerable in our community, especially the growing number of youth and families experiencing housing instability. Lisa, could we bring you up on the screen for our Pledge of Allegiance?
Thank you, Supervisor Askew and fellow supervisors. I'm honored to lead today's Pledge of Allegiance. Should I go forward?
Yeah, we can begin.
Okay. So I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Wonderful. Thank you for joining us today, Lisa. I think it's only appropriate as we talk about homelessness and county housing needs to have you here getting us started.
Thank you. I appreciate the opportunity.
Okay. We are on Zoom at webinar ID number 224-397-747. Anyone who's watching us live on Facebook or YouTube, you're welcome to hop over to Zoom to join us here as well. We have a 1:30 scheduled item, which is a briefing and update on COVID-19. And then following that, we will move into our special workshop on on homelessness with some county presentations and discussion. So hopefully we'll be able to get that started right at about 2:15. But for now, we will begin by introducing Nick Chulos for our COVID update. Thank you.
Thank you, Madam Chair and board members. Good afternoon. We'd like to start out with an update on COVID-19 for the board and the public. And we'd like to start with Christy Mishi with a public health update, then ask Kim Stemler to comment and update us on testing strategy, and then ask Dan Baldwin, the Executive Director of the Community Foundation, to give an update on the Community Foundation's efforts. Thank you, Madam Chair.
Wonderful. And just in the sake of time, we're going to try to keep our COVID update to 30 minutes today. So if we could keep everyone, just take a look at the clock. Thank you.
Good afternoon, Chair and Supervisors. Let me share my screen here. Okay, so today I will be providing a brief update in Dr. Moreno's absence. My name is Christy Mishi, and I'm the Assistant Director of Public Health for the Health Department. We'll start out with just an overview of some monitoring metrics. Just this slide provides a status of the countywide of different monitoring metrics. And what I will emphasize across this slide is that most of our metrics are either improving or they're stable, which is a good place for Monterey County to be in right now. Our case rates are decreasing, our test positivity rates are decreasing, our hospital ICU capacity is stable, as is our testing turnaround time, and our vaccination covering is increasing. This past week, we've reached the point where 41% of our residents who are 16 years of age and older have received at least one dose of COVID-19 vaccine. This graph is a familiar graph for you all. We've been monitoring our case rates over time through the pandemic. And what I wanted to point out here was this little bump we saw a couple of weeks ago where our case rates went up. As you can see now, this has declined a little bit and stabilized out. We want to keep watching this. This is the trend we want to keep. We want to keep our case rates stable or declining. And in order to do that, we need to all work together to make sure that we're doing things to reduce transmission of COVID-19. First and foremost, everybody who's eligible for vaccination should get a vaccine. But even those who do, or those who are pending their turn in line to get a vaccine, should make sure that we continue to wear a face covering when we're outside of the home, avoid large gatherings, keep washing our hands frequently with soap and water, practice social distancing so that we're staying at least 6 feet apart. And if you do become sick, it's very important that you get tested, even if you've received a vaccine. So those who have frequent exposure to the public, who may have been exposed to somebody who's sick or may be feeling sick themselves, should seek testing services. I want to spend a little bit of time talking about the blueprint, which was announced yesterday. So California did meet the second goal of its vaccine equity metrics. So you can see here highlighted in green are the new thresholds that determine when Monterey County will move through different stages of the blueprint tier. And as was announced yesterday, our metrics did meet the orange tier for all three or better for all three of the metrics. So we are able to open up our sections of our industries and economy starting today that match the state's guidelines for the orange threshold. The governor also announced yesterday what is being called beyond the blueprint. So what's happening in the future? What happens when our metrics continue to improve statewide? So the governor's announcement was that on June 15th, California is going to fully open its economy if two criteria are met. And those criteria are that there is sufficient vaccine supply for Californians who are 16 years of age and older who want to be vaccinated, and making sure that our hospitalization rates stay stable and low. Some of the other information that was shared was that the statewide masking requirement will still remain in effect. Masking is an effective way to decrease transmission. And so for the near foreseeable future, that will continue in California. And in certain settings, there still will be testing or vaccination requirements as we move through this transition period beyond the blueprint. Also released this week are some updated guidance that CDPH shared. One is effective April 15th and is related to indoor events and live performances. The other was that fairs were added to the guidance document under amusement parks. So if there are agencies planning local fairs, you can look to the amusement park section to find out what your guidance are or modifications might need to be made. Also updated was the youth sports guidance. Spectators and observers are now permitted pursuant to the outdoor seated live events and performance guidance. And the restriction that inter-team competitions and meets had to be limited to those with counties with touching borders was also removed. So moving on to vaccine allocation and distribution, this graph shows how the supply of vaccine coming into Monterey County has changed over time. And if you'll notice on this last week, week 13 of this calendar year, we received about 30,000 doses coming into Monterey County. That does include 3,000 doses that were a special one-time allocation to support the clinics going on at the OptumServe testing site in Soledad and in Greenfield this coming weekend. So our vaccine rates, our supply rate has been pretty constant the last few weeks. Unfortunately, we have received notice from the California Department of Public Health that California's supply of vaccine is going to be reduced this coming week by over 400,000 doses. So that's really unfortunate. All counties across California will likely see a decrease in their allocation next week. These next few graphs or tables that I'm going to show look at among all the
let's see if I can
that we receive each week, how that vaccine is distributed across different populations. And here, this graph shows the quartiles for the state's equity metric. And just to remind folks, they're not evenly distributed across the county. These first two quartiles actually represent about 70% of Monterey County's population. Our target is to have 40% of our doses in the first quartile, 20 in the remaining. And while we haven't quite met that for the first quartile, we are sort of overshooting our mark in the second quartile for vaccines. This looks at the same sort of distribution, only by regions of the county. The top bar shows what proportion of the population 16 and older is in these areas. And what we're looking for is to make sure that the vaccines are getting distributed across the areas of the county in a way that matches the population distribution of the county. And you can see there's about 12% of our population lives in North Monterey County, and on this last week ending April 3rd, the allocation of vaccine we got that week, about 12% went to North County residents, 36% to Peninsula and Big Sur residents, 41% to Salinas residents, and about 11% to South County residents. We do look at the same thing, only looking at racial and ethnic groups across Monterey County. Again, the top bar represents the population distribution of Monterey County among those that are 15 years of age and older. The bottom bullet here shows our most recent data. Distributed, how those vaccines that we got last week in Monterey County were distributed across these age groups. And lastly, this graph is a little bit different. This looks at the population of Monterey County split into regions. And among that region starts looking at what percentage of the population in that region that's eligible for vaccines, so those 16 years of age and older, have actually received a vaccine. So about 35% of North Monterey County residents who are 16 years of age and older have received at least one dose of vaccine. On the peninsula, the percentage is about 44%. Salinas is about 42%, and South County is about 33%. Overall, again, we have reached a point where about 41% of our residents have received at least one dose of vaccine. And supervisors, that's the end of my update today, and I'd be happy to take any questions.
Thank you, Christy, and thank you for holding down the fort while we give everyone else some much earned and desperately needed vacation time in public health. Colleagues, Supervisor Lopez.
Thank you, Chair. Christy, I'm wondering if you could take me back to the slide, one more back, that one. I'm concerned about the 4-3 data for South County and wondering what strategies we're implementing to make sure that that is simply a blip and not something that's going to continue.
Sure. So we do have some upcoming vaccine clinics. We are trying to get more vaccine to the South County area. So as I mentioned, there are 3,000 doses of vaccine that are earmarked specifically for vaccine clinics happening this Friday through Monday in Soledad, and then Saturday and Sunday in Greenfield, that are state-sponsored vaccine clinics that will be administered by the OptumServe staff. In addition, on Saturday, there is a vaccine clinic at, I believe, the high school in Greenfield, where we're making some additional doses available. So we're making some focused efforts to try to bring more vaccine into the South County area.
Thank you. I appreciate that. And then my other question was simply, I know that there was some new guidance released for gatherings, specifically thinking of groups coming to, say, the conference center. And while the state has released that, we as a county have not yet put anything out about that. And I have received some questions. Early on, there was some differentiation between county policies and state policies. I'm assuming that we're simply going to follow that state guidance. But I think it would be great if we signaled that to our conference centers and communities on the coast so that they're comfortable moving forward with their planning if that is the case. I'm wondering, can you share if there's any intention to do anything other than follow that guidance from the state at this point?
In general, Dr. Moreno has made sure that his guidance is reflective of the state's guidance. And in general, he chooses usually not to be more restrictive than the state guidance. So the expectation is that the health department will support the state's guidance and recommend that local businesses and agencies follow the state guidance.
Great. Thank you, Christy.
Supervisor Phillips, this is going to be difficult. We've now got digital hands raised, in-person hands raised, but we're going to make it work.
I just want to thank you for the report. It's one of the most positive reports we've gotten, so I have to have you give the presentations more often. So thank you.
Thank you. All right, Supervisor Adams.
Thank you. I concur, Christy. It's going to have to be you all the time now. But I did have a question about the gatherings again, and again, thinking about the conference center specifically and the renewal of small conferences and conventions locally. There was some indication that there would be restrictions on people coming in or going out of state. And I was wondering if there's been anything, I think actually the language was that, you had to be from California if you were going to be gathering. Is there anything further on that? Are you familiar with that concern?
We haven't received any additional clarification on that. We do know that the state expectation is that the individuals hosting the events, are following the guidance and making sure that the participants who attend are compliant with the guidance. But I will have to, wait for some further guidance from CDPH to be able to, clarify that for you.
Thanks very much.
All right, any other questions or comments from the board? Seeing none, we'll proceed with our update on testing. Thank you so much, Christy. We do appreciate the positive information. We'll move forward with our testing strategy and coordination update, and I'd like to welcome Sandeep Gupta. And is Elsa Jimenez with us today?
Madam Chair, I believe it's Elsa Jimenez and Kim Stemler.
Okay, Elsa
yes,
Jimenez
Dr.
and
Gupta
Kim
was unavailable
Stemler.
today. So.
All right, wonderful. Thank you.
Hi, good afternoon. This is Elsa Jimenez. Kim Stemler is actually going to get us started.
To get off of mute. There we go. Okay, let's try this again. So I am a poor substitute for Dr. Gupta, so I'll try to do my best and then also will follow up. I'm here because I have taken on a consulting role with the Community Foundation COVID-19 Collaborative as project manager for vaccines and testing. This is brand new. I am still director of the Monterey County Vintners and Growers Association. This is on the side. So that's why you have me today. I'm going to go really fast, but Elsa and I can respond to any questions. We just want to honor all of the things you have to go through today. So as you know, the Community Foundation Collaborative, which is a partnership of the health department and a lot of other public and private entities throughout the county, came to you on March 9th, I believe, and presented a preliminary testing strategy. We have since refined that, and on Monday, we actually had a webinar with the state. Sorry about that. We had a webinar with the state offering many more resources. So we've been to you, we've refined strategy further. There are a bunch of awesome people on the Science and Best Practices Advisory Group. I'm not going to go through them. And there are wonderful people on the testing work group as well. So know that these come from people that have experience both in science and in this community. So when I say testing, when we say testing, you're probably more focused on vaccines, especially since today we're moving into orange. But the reality is we need to continue focusing on testing. If we continue focusing on testing, we won't be in the same position that we've been in for the last year. If we continue testing, we can reduce direct transmission. We can find those people that may be contagious and break that chain. It allows us to provide surveillance for the variants that are coming into the county and into the country. And we can look at the populations that are disproportionately affected by COVID-19 and continue to support them. This is a really collaborated effort that is very distributed. Our goal is to make it user-friendly, both for the end user, for the individuals that are getting tested, and also for those partners in the community that are helping with testing. And we're building on the existing capacity within the community to do that. And I'm not going to go into this deeply. So one of the things we want to do is expand testing in workplaces. And to do that, we need to make that really simple. And with our partners from the state and what they're able to offer us, we are putting together programs where they're self-swabbed. And it would be very simple for a business to have either to do it themselves with their employees or to have a group come in and supervise the testing with employees. Very, very simple process. And then also we're going to expand that same system to neighborhoods using community partners. We could be partnering with the faith community. We can set up something in front of the market. We can set up something. Yale just had a study out saying we should vaccinate in front of dollar stores. We can test in front of dollar stores if we get agreement from whoever owns that property. So there's a lot. So what we're doing now is trying to be nimble, work with partners, be very coordinative, and make it really easy and friendly. And Elsa, I think this is a good time to shift over to you. Is that okay?
Yeah, definitely. Thank you, Kim. So Elsa Jimenez with the Health Department. Continuing on this, we do recognize that not all of our communities are impacted at the same level with respect to COVID. And so as we've done previously with your board approved pop-up testing, we would also want to make sure that we prioritize those zip codes and communities that have higher case and test positivity rates, as well as lower testing rates, to ensure, again, that we are identifying COVID before it spreads further into these communities that we know are already disproportionately impacted by COVID. Next.
Come on, sorry.
And, we do know that statewide there is a decreased demand on testing. As, Kim started out with, most people now are focused on vaccination and wanting to get a vaccine. But we can't ignore the fact that it's still very important for us to continue to have a certain level of testing in our community to help identify COVID before it spreads further, and more importantly, now that we have so many variants circulating. And so in order to be able to increase demand, the approach would be to help reduce testing stigma, explain again why the testing is so important, make sure that we're working with our trusted partners, both the VIDA Project 211 and others, to make sure that we're sharing the message and really help encourage the community to access testing services available to them. Next. And, you know, we wouldn't implement this without ensuring that there's an evaluation plan incorporated. Again, this would help to ensure that the testing services are made available in those communities of greatest impact. So there's a whole process in terms of how we're going to be and the frequency that we're going to be evaluating the data and getting consumer and customer feedback to make sure that the services are deployed in the places that they need to be, and more importantly, that the demand is there from the public to access this resource. Next. And so previously we presented a particular testing target. We've gone back and looking at our current testing rate, as well as looking using the blueprint for a safer economy as a metric for determining the number of tests that we would conduct. Now that we are in this tier 3 or orange, which looks kind of brown, but the tier 3 moderate, you know, our goal would be to have 750 tests per 100,000, and currently we're at about 267. So as you can see, we do have a little bit of work in terms of educating the public about the importance of continued testing and accessing testing and making sure that those services are deployed. If in any event we were to experience a severe surge, then we might revisit this metric and this table and guide and probably revisit the number of weekly testing target for Monterey County. Next. And so here we are before you today to present to you what we presented in terms of the particular venues and the types of testing that we hope to be able to make available, and also seeking support for some financial resources to be able to implement the plan as presented. You know, most of the supplies and materials are free, but there may be instances, depending on the volume of tests that we're conducting per week, where we may need additional supplies in terms of PPE and other materials that are needed at the testing sites. In terms of being able to increase demand, we think that providing an incentive, we might be able to draw in individuals to actually access the service. And we talked about the importance that VIDA and 211 and other community partners may play. And so if we do see an increase in the demand and calls to 211, we would like to have some dollars to be able to support United Way's 211 call center. And I think this is really the budget. And so we propose a 1-year strategy and budget that would help to provide resources needed for testing materials, processing, PCR test to track the variants. You can see there that it's not included in the final ask of $735,000. That is an expense that we've included in the health department's ELC grant that we hope that the state will approve our budget as presented. And so we'll be able to have that covered. We anticipate, you know, giving a $10 incentive to individuals to encourage. And again, this would be strategically deployed in those, particularly those communities where we are having very low test rates and high positivity rates. So really, in the end, the total budget ask and need for resources is $950,000, $216,000, which we hope to have secured through our ELC grant with a gap of about $735,000. And so next steps is coming before your board to present this final plan and seeking your support for funding for resources as needed. We anticipate that these expenses would run through the county's agreement with the Community Foundation of Monterey County, and so an amendment to that contract may be merited to be able to include some of the expenses for the stipend, as well as for any of the materials that are needed. And then the county also has a contract with a separate contract with United Way for the call center. And so as needed, that contract would also be amended to be able to add dollars for additional support being provided by 211 if an anticipated increase in volume. So that would help to kind of get those resources in place. The collaborative will continue now that we have Kim Stemler as our project manager. And supporting the collaborative in this effort, really working with the employers and some of our cities and other community-based organizations to be able to strategically deploy the testing resources that are available through the state and others to ensure that we provide these services in the neighborhoods and the communities and the work sites at greatest risk for exposure and potentially be able to help us identify COVID transmission before it becomes a significant spread in our community. And that concludes, sorry about the vacuum in the background, and that concludes our presentation for this afternoon. We're available to take any questions you may have.
I thought you were supposed to be on vacation this week.
And here I am.
Again.
I don't know if Chair asked you if you're speaking. We don't hear you.
We have audio. Let's
Now
try
we do.
audio again. Is that working now? Okay, very good. All right, yes. Elsa, we'll have to schedule you another week of vacation since apparently you've been working all week.
I think I'm going to take a 6-month sabbatical next year sometime.
You've earned it. You've earned it, my friend. Colleagues, any questions or comments in regards to the testing strategy as just presented?
I had.
Oh, thank you. Supervisor Phillips.
You talked about, and I certainly appreciate how difficult it is to get people testing because everybody's so oriented towards the vaccine. But you mentioned extending this a year. Are you talking about testing beyond June 15th? Do you think it's going to be required and necessary?
There is this goal about June 15th, but we do know that there's going to be a large segment of our population that isn't going to be vaccinated yet. We know that right now the vaccines that are on the market are for 16 and older. And so I think we'll just have to continue to evaluate. Again, this is based on information we know today in terms of where we are with our testing rate per 100,000, where we are with our vaccinations. And as we mentioned, this process is an iterative process and we'll continue to evaluate the data on a weekly and biweekly basis. And so it could be that, maybe only 6 months from now or 5 months or 4 months. And so really the ask right now is for a year support, but we'll be seeking amendments to the contracts as we need to be able to kind of scale up this effort and only expend those dollars that are necessary to implement the strategy, however long we feel from a public health perspective that we need to continue to have testing available in our community.
I got to say that I think the incentive, even the $5 incentive to get food or a hamburger, I could, if I had that incentive, I think I could fill the opium clinic at Castroville if you gave us that. But the other thing, I think we have to make it convenient where we're taking the test sites to where people are and to make it convenient for them, and at a shopping center and they're stopping by and make it easier for them, or at the work sites. So, but thank you for your work and thank you for the report.
Thank you. Supervisor Lopez.
Yeah, I just, looking at where we are right now, looking at $1 billion, I think I'd rather incentivize vaccinations. I think very quickly here we're going to be at a point where we're going to hit the point where a lot of people are no longer going to be wanting access. I'm looking at the appointments being open longer and longer and longer. And I'm wondering if we should instead shift to focus on incentivizing vaccination rather than testing in terms of a long-term strategy. I'm just concerned. I get that testing is important and I think it's available to the community where necessary. But for me, it's a bigger picture question about where we're going to be in just a couple of weeks based on the eligible or the eligible population and the openings that I've seen stay open as long as they have at clinics. And so for me, in terms of where we're going to allocate our resource right now, to me, that sounds like a better strategy from everything I'm reading. And I guess that partnered with what we're doing with VITA has me kind of wondering if we need to look at where we have our resources currently allocated to shift to make sure we're meeting all needs. I'm just not sure that throwing in another $1 million on testing right now is the strongest strategy. That's where my mind is today. So I appreciate the work and I see the value in it, but I'm just kind of watching where we're going rather than where we are and have been, and wondering if we need to take that into account. Thank you.
Thank you. Supervisor Adams.
Sort of following up on Chris's thought. So how do the community health workers and the VITA program interface with the new testing project?
We're just beginning to talk about that, Supervisor Adams. It would be great if they could, but that dialogue needs to happen. I can tell you more after we've had the dialogue. We haven't yet,
Right.
but we did broach it. So again, I just started Monday. We just talked to the state on Monday and found out what resources they had. So this new program in its new design we've had it for 2 days, and haven't, although we have talked with both Krista Honey and Rosemary about the community health workers, we haven't pursued it any more deeply than that. It would be great if they could be involved, but there's concern about their capacity and whether they can do that. And I'll report back and let you know.
Thank you. That would be terrific. I noticed that I guess it'll be part of this report that just looking at there's a surplus in the funding for the community health workers in that line item, and I think it's the next actual subject that we'll be talking about, and I can just hold my questions until we get more into that project. But thank you very much for your presentation, Kim.
Thank you.
Supervisor Alejo.
I just wanted to echo some of the comments that Chris made, because there hasn't, at least from our analysis, been a shortage of testing. The resources have been there. The appointments, the different times. I know they've curtailed some of the day availability for them, but I don't see that being where the greatest need is at this point. Earlier this week, we were having problem just getting the vaccination appointments filled in, and I just checked right now, and luckily for Saturday, most of them are filled. There's only like one appointment left in each of the slots, the ones that are not already booked. And then on Sunday, we have 5 or less, where at one point they were completely full at 29 for each 5-minute slot. So some good progress has been made there, and I hope all those remainders are filled by Friday. But I think at this point, as we open up larger mass clinics, I think the resource should be in trying to get those filled and getting more of our residents vaccinated. That number that was put out by Christie, 41% of residents are now vaccinated at least with one vaccine, is a great number. But we still got almost 60% still to go. And the significant drop in terms of the infection rates is very promising. But again, we can't let our guard down. So I think at this point, I think we should be looking at where we could make strategic investments of resources, but I think the shift has moved significantly towards making sure we're getting more people vaccinated at this point.
Thank you, Supervisor Alejo. So my thoughts are, I'm really excited to see that we've finally moved forward and are bringing forward a testing plan. As a mom with a young child that does not have a vaccine scheduled in the foreseeable future, I want to know that we're continuing to track outbreaks of COVID in the community, especially when the previous mechanisms of hospital capacity may not be as relevant as a figure, being that we've been able to vaccinate those who are most likely to end up hospitalized, but we're reopening schools. We continue to hear that there remain a fairly large segment of the population that is not interested in receiving vaccinations. Upwards of 30% of our healthcare professionals, 40% of other industries locally. So I do think that there remains a significant need for a comprehensive testing strategy, and leveraging the state resources that are available to us with a relatively small local investment seems to be a prudent and responsible next step forward for Monterey County, especially when we look at the number of people from outside our community who come into our community, both for agricultural workforce and our tourism economy. So I'm very pleased to see this come forward. I would like to, I'm supportive, whether it's the full $1 million that we need to fund for a full year, or whether there's, a partial ask that comes forward. My question would be, would this come forward as part of a budget request for June, or do you need to bring something forward before then?
So I think the purpose today is to present the updated strategy and a tentative proposal for funding. And as I mentioned, the county already has an agreement in place with the Community Foundation, who has agreed to be the entity to funnel any dollars for the stipend or any dollars that are needed for materials. And then the county already has an agreement as well with United Way that is helping to support the 211. And so those two agreements would be modified as needed if your board in concept approves the updated testing strategy and the fact that there may be a request for additional dollars. And so then the official action then would come before when we bring forth those agreements to be amended.
Okay. So we're not making a decision today, but I'm not hearing a clear consensus for action from my colleagues. I hear some concern about this being the appropriate use of funds. I hear others who feel strongly in support. Is there consensus to have this come forward for a formal vote of the board? Supervisor Phillips?
Well, I tend to agree with Chris, and that's why I was asking if we're having this go past June 15th, but I don't know whether I could support $1 million going into it, but maybe half of that. But even when we were talking about testing, and when we were trying to crank up how we get more testing, and the hospitality people were pushing that, we were asking Dr. Marino how much difference that would make, and it wasn't as firm a commitment that it would make that much difference in our overall process. But I support the testing if we can do it strategically and get it out to the right places. But like they're saying, with so much emphasis on vaccination now, I think maybe $500,000 versus $1 million.
Supervisor Adams?
Thank you. What I would suggest is that you go back and speak to the other side of the house, so to speak, with the VITA program, and see if there is some way that we could combine efforts, so that we, rather than just saying, oh, let's do $500,000, let's come up with some real numbers, looking at the $5 million that we've already given to the VITA project, and see if we couldn't see some economy of scale. And then, Kim, my hope would be that after the meetings that you have, then you could come back to the board with something that might be a little bit more definitive and specific.
Great. And then
right.
if I may,
Please, go ahead.
I would like to take this opportunity to take up the board's comments with respect to, do we need to be incentivizing our residents to get vaccinated? And even though here today we're presenting a testing proposal and a testing incentive, which I do think is still important, and I hope to get approval from your board to be able to implement that. It would probably be also good to work with our VITA program CHWs to also help encourage residents, particularly those in the quartile 4 or in higher risk places to actually get vaccinated if they're hesitant. And so following the same model in terms of a $10 incentive to get people vaccinated, if the board is agreeable to that, we could also explore that with the community foundation. And then there could be that, you know, the dollars don't necessarily have to come from the Board of Supervisors. There could be an opportunity through the Community Foundation and through the grants that they've received or anticipate to receive to also help partner and help fund some of these expenses. So as I mentioned, as needed, we would modify the existing agreements to be able to add any dollars, and then a specific ask from the board would be made at that point. So going back to what I just rambled off is, if your board is in concept agreeable to implement this, make it more readily accessible in the neighborhoods and in the workplaces, we'll proceed with that. We'll work as closely as needed with VIDA to get, again, the community to hear from trusted partners about the importance of continued testing, make a stipend available as needed to encourage. And then also at the same time, many of our VIDA CHWs are also out in the community now trying to encourage individuals and dispelling myths around vaccination. Also make a stipend available, particularly to those residents in Q4 or who are in workplaces of higher risk. And making that same stipend available to them to encourage. We do think, you know, there are quite a few open slots still for the clinics that are happening this weekend. According to our local public health experts, we think that once we open it up to 16 and older, that probably end of April, beginning of May, we'll start to see open slots. And so we may need to incentivize our residents to go in and get their vaccine.
Okay, so in the interest of time, I think we've all had a chance to weigh in. It sounds like there's some consensus to bring this back for some with some specific
Madam Chair,
actions for the board to consider. Supervisor Alejo, please, I'll give you a chance. Hold on.
Yes, you allowed other people to speak twice. Yes, I want. That's what I would definitely be open to, is seeing incentives on the vaccination side, and because I think the strategy is not just to say yes, let's throw money, $1 million here for 12 months. I think it has to be strategic, specifically focused, and approve money for 3 months, and then let's look at where it's at, how it's working, and then make modifications and extensions there. I think that's the more strategic, because what's going to happen from now to 3 months will put us in a different position, and then the 3 months after that, we'll constantly be having to modify our strategies as we increase the vaccination amount. But I agree with Elsa. If we could create an incentive program for the vaccination, I am definitely open to that.
Thank you. And respectfully, I will call on everyone who has their hand raised. So as we move through our agenda today, I do want to make sure that we are also aware of the time. We had a long meeting yesterday. We have a lot to get through today. So if there's anyone else who has comments or feedback for this particular item, please raise your hand. I will call on you, I promise. Otherwise, I'd like to move forward with our Community Foundation update. Seeing no hands, we'll invite Dan Burns to join our meeting. We are on a timeline. We do have a long homelessness workshop that we would like to have plenty of time available and focused. So Dan, thank you for joining us. We're happy to have you on board and welcome your update today.
Yeah, I'll be very brief, to Supervisor Askew. You know, I've updated the board in the past, so I won't do any review. I'll just pick up from where we are now. We did receive some significant grant funding that allowed us to hire 2 project managers, a project manager to work with the VIDA program, the CHW workers. That is Joel Hernandez, who is an employee of the Community Foundation, brand new, came to us from CCA and has been very involved with the CHW program since the outset, and he is already making a great impact. So the value of that to the county is that he'll partner with Rosemary Soto and Chris Tahani and be a coordinating person, so we can lift that out of the county responsibilities and free up more time for you know, your folks to be more effective. And then also, I think this program has the potential to have long-term benefits to go carry on beyond you know, our current pandemic. And so Joel will be charged with that sort of sustainability aspect in terms of the culture of the program. You already met Kim Stemler. She has come to us as a consultant. I was in another meeting from 1 to 2, so she is, if she said this, I apologize. She's still the executive director of the Vintners Association. She has board approval to do consulting work, and she's already doing some of this work. And you can tell already that she's made in just a few days, she's made a great impact. And that's because she's been involved with the collaborative from the beginning and has been involved in these conversations around COVID response going into last March and April. So she comes with a tremendous skill set. We also used our other consultant, Consensus Building Institute, to create to do a mapping exercise so that we can know all the testing and vaccination sites and assets that exist in the county. I don't know if I have permission to share screen. It looks like I might. I just wanted to give you an idea of what it looks like. And it's yes, it's still in process. So you can see the Optum serve. We don't have all of those sites listed, but this is a great tool that's been created so that and whether it's Chris and Luis have talked about strategic tactical investments and personnel and resources and how we direct people, how the VITA workers are able to direct people. Well, this is a wonderful inventory that people can work from. And this has already been handed off, of course, to Kim Stemler as she helps to organize testing and vaccination projects going on in the county. We have a collaborative meeting at 3:30 today, and at that meeting, we'll be talking about the goals that we have for April and reviewing the goals that we had for March. And just to go through that, our March accomplishments were to get the VITA program going, hire 2 project managers, map testing and vaccination capacity, and develop testing strategy, all of which we were able to accomplish. And then our April priorities, vigilance on all protective measures, which include testing, businesses on prevention practices, increased testing, equip CHWs, and vaccine messaging. These sound vague, but the March ones were vague at the beginning, and then they got really specific. And so there's been tremendous progress made. I do want to emphasize one little thing before I wrap up. We do have the June 15 announcement by the governor. We have optimism. Statistics are trending in the right direction, and I'm going to be the voice of, well, maybe a devil's advocate here. This is not the time to take our eye off the ball. 5 states right now are reporting enormous spikes in COVID infections. As we open up the economy, vaccinations notwithstanding, as we open up and get sports and sports venues and restaurants and travel, people moving around, we don't know what our future holds. And I do agree that the emphasis should be on vaccinations, but we cannot at all ignore the role of testing. And so I do support what Elsa and Kim brought forward and that Supervisor Askew asked us to do. So the last note here is this is a rapidly changing environment. If I was here a week ago, I would have given you a different report than I'm giving today, and it's going to continue to be so. So that's what this collaborative is here for. It is here to adapt to these changing circumstances, work closely with public officials and the private sector. Our meetings are, it sounds redundant, they're highly collaborative at this point. And there's a lot of trust that's been built, and it's really it's making an impact, and we just hope it will continue to do so. So, Supervisor Askew, unless there are questions, I'll just end my report there.
Great, thank you. So are there any, this is the end of our COVID update for today. Any final board questions or comments? Otherwise, we'll take it out to public comment. Seeing no hands, I'll open it up to, oh, sorry, thank you. Supervisor Phillips.
Thank you for the report, Dan. I gotta say something you said there bothered me a little bit in that my concern when we invested $5 million into this was, and you know, we're being pretty generous. I mean, we're paying $25 an hour plus benefits. My concern was when we expended the $5 million and went through the 6 months and got a handle on it, that there was going to be a push. Well, we got to keep this program going even after COVID, and I predicted that might be a concern down the road. So that's a concern of mine. If we're coming back and saying, well, we need another $5 million to keep this program now, that's a great program after COVID. So just.
So, Supervisor Phillips, I did not make that comment as in anticipating future county funding. So I apologize if it came off that way. I just meant that the role of the CHWs and having this become a model that can be used going forward. So I apologize if I gave that impression.
Okay, thank you.
Thank you, and thanks for helping me look up here. So we'll take it out to public comment. For anyone who's following us on Zoom or YouTube, the Zoom ID, Facebook or YouTube, you will need to join us on Zoom to make public comment, and that webinar ID is 224-397-747. I don't see any hands raised on Zoom, and we don't have anyone here in the audience today. So we'll close this. I don't believe any direction was needed, so we can move right along to item number 2, which is to receive an update on our community health worker project, now called the Virus Integrated Distribution of Aid Project, formerly known as the Community Outreach and Education Pilot Project. I believe we have Rosemary Soto. Hi, Rosemary. Thank you for joining us. And again, if we could keep our presentation and comments to 5 minutes, that would keep us on track today. Thank you.
Good afternoon, Chair and Supervisors. I'm going to share my screen. This is not a PowerPoint. This is included in your packet as an attachment. And for the sake of today's presentation, I will be as brief as possible. And I will also mention that Michael Castro with the Community Foundation is here with me to be able to address any questions specific to this budget reallocation request here. So basically, the ask today is that you receive this report and also consider approving a proposed budget reallocation. In essence, it's a modification to the initial budget that you approved in December. I'm going to point out that there are specific budget categories listed here that were approved in the initial budget, and that is, personnel, operating expenses, travel, quarantine support, and indirect. So there are budget line items within each budget categories, and I will briefly go through some of these areas that have shown that after having received these funds and after the Community Foundation completed their grant making process, where we received budget requests along with proposals for the strategies that the community partners would implement for this VIDA project. What we know now is that there were some gaps and some remaining funds in specific line items within each of these categories. So in the first one, what we see is that there were some remaining funds in the community health worker line items under personnel, and there were some gaps under the data analyst and coordinator positions. So what we're requesting is that in the proposed budget reallocation, we be able to move some of the funds that are in the remaining areas into the areas where there are gaps or where we are falling into a deficit. And so you'll see that this has occurred in the first category under personnel, also under operating expenses, we've fallen short with a deficit in 2 of the line items in printing and phone service. And yet we have remaining funds that are not allocated or have not been allocated yet in the PPE section. And we see it again in the quarantine support, where we had a deficit of about $20,000 in the emergency essentials. And we would like to move some of the funding from the quarantine line item to be able to make the emergency essentials line item whole. So in essence, this column here as a proposed budget reallocation essentially does that. It moves some of the funds around within the same budget categories as you had approved before. And what we're requesting is that you approve that modification. And we're coming back to you with this request because when we presented this budget to you in December, we were very specific about where these dollars were allocated in the budget categories and in which budget line items. So in order for us to move the dollars around to be able to fill the gaps where they are, we want to make sure that we bring this to your attention and that we seek your approval to be able to do that. Now, once we have in this line item, in this column here with the proposed budget reallocation, the total that we see will be moved around. It brings us still to a $4,062,624 and leaves us with remaining funds of $927,026 that remain unallocated at this time. And our request is that you approve that we leave this remaining funds as contingency funds. Contingency funds, basically the term, we're using it here for the purpose of, again, being able to assess where are there any future gaps or where are there any reallocations that might need to happen. And at this point, what we would like to see is that if we would be able to ask that you authorize our county administrative officer or his designee, whether it be assistant county administrative officer, to be able to receive a request from the project, from the community foundation, to be able to shift and modify the budget once again. And that is if it is necessary. So there will be a process for reviewing and approving any budget modification or reallocation. Again, the purpose of that is to make sure that we have the flexibility to be able to shift the funds where it is most needed, and also to ensure that there is proper oversight over how and when that happens. And at this point, I don't know if there are any specific questions, but in essence, this is my presentation and request that you consider approving a proposed budget reallocation and the allocation of contingency funds for the remaining unspent funds.
Thank you, Rosemary. I see Supervisor Adams first.
Thank you. Thanks very much. So Rosemary, I do just have a couple of questions, and regarding first the allocation. Number one, I approve. I think it's a good idea to go ahead and reallocate the funding as you see fit for the program. I would just want to be sure, though, that were you to go in with the contingency, that the board would have some input on where that's going to go, if it goes anywhere outside of the current line items that you have. So that would just be one of the thoughts that I would have, just to ensure that we're keeping our eye on everything. And then I don't think I heard you touch on this, but looking at the gaps in the remaining funds, specifically not the gaps, but the remaining funds in the community health worker line item. I know that that was very specific, that we would get 100 people to do this. And I'm just wondering if these are vacant positions, or if you determined that once you really were on the ground and assessing where the workers were going to be going, that we simply had enough people on the ground, or is it that it's impossible to find people to take those positions?
That's a very good question, Supervisor, and I'll answer that one first. The we do have actually about 110 CHWs that were hired and brought on. The equivalent of an FTE is probably slightly less than 100, but we do have enough people who, for this time, at this point in time, that each partner organization can manage. So each partner organization has a different number of CHWs on board on their teams. And some are at a variety of full-time and some are at part-time. So it really, that's why it was very difficult to fully gauge in the beginning exactly how many were going to be able to be fooled completely. We knew that our goal was 100 and we're at 110, but again, when you break it down for the hours, this is how we ended up at a remaining funds. Yeah.
Got it. Okay, perfect. Thank you for that response. And then can you just elaborate a little bit on the quarantine stipend? Is it just for the housing costs? Is it housing and food, income replenishment? And how is it different from the county programs that we have going now?
So it is very similar to the county programs. At this point, that hasn't fully been rolled out simply because of the fact that there are all these other programs that we would encourage that they be exhausted first. And, you know, so that way we can then, for one, learn from their lessons and make sure that we don't repeat the same mistakes. And also make sure that we're able to have a very clear and streamlined process to be able to promote these funds and access them as easily as possible and have that flexibility, because we know that some of the other existing programs have restrictions, and so certain restrictions that further impede those that most need it. For example, if they require immigration status or citizenship, you know, those are some potential barriers. And I mentioned that, you know, Michael Castro is on here with me. I don't know if he has anything to add specifically around the quarantine support. Michael, I want to give you the chance to expand on that if you have additional information.
Yeah, thank you so much. So yeah,
so sorry, if I may, I just want to, and so Supervisor Adams, I just think, you know, just in the interest of time, if there are specific questions that we need to get answered in order to take action on this item today, but if there's more detailed questions, maybe we could have an offline conversation so that we can keep the meeting moving forward.
I'll bend to that, Wendy. I think that's fine. Rosemary, thank you so much, and Michael, I appreciate your willingness to speak. I'm good for these questions. The other ones are more, just tell me more about what the CBOs are doing. I don't need to know that and take up this time, which I know is limited and valuable. So I'm good. Thank you very much. Great program. Keep up the good work. And
thank you, Supervisor.
Yeah, sorry to interrupt, Michael, and sorry to cut you short, Supervisor Adams. I know we are on a timeline today, and I appreciate all the input, but keep us moving. Okay, Supervisor Lopez.
Thank you, Madam Chair. Yeah, I just, I guess my request would be for a bigger update on the outcomes so far. I mean, I'm looking at this, we're being asked to move the budget around to meet the needs, but I don't understand what the need is based, you know, all I'm seeing is a budget and a request for things to be moved, but I'm not understanding what's happening on the ground. And I think those two partnered together would have been a better ask, in my opinion, to understand why that shift is needed. I'm willing to do this, but would ask that we get that report back soon, just to better understand what outcomes we're seeing based on the shifts. Thank you.
Thank you, and I would agree with that. Supervisor Alejo.
Yeah, I agree. These smaller changes to cover the deficits, not that they're not significant, but they're just small compared to some of the other line items. I'm okay with those, but on this contingency, we had this conversation as part of our budget talks yesterday. We have to reevaluate how we're going to perhaps use that proposed contingency more for perhaps an extension of the program. And I think when we get these numbers, I think we have to also continually get progress reports on the work that's being done, because initially when we created this program in January and February, it took some time to hire up the staff to get, kind of a full scope of people being reached under the program. But as the vaccination rolls out, that is obviously going to change, because as more people get vaccinated, the same amount of contacts will obviously not be the same. So that's why yesterday I said, looking at the progress of the program from February through March and now April, and then in May and June, we have to relook at, is the program really going to be needed at the level that it was when it first started, or do we right-size the program to continue for a period of time more, but with a lower amount of staff, because obviously things are going to change, especially the governor's goal to reopen the economy come June 15th. If the two conditions are met, are going to create, we're going to be just be in a different situation than we were in December when we approved a program, and then January when we started staffing up the program. So as when we start looking at extensions of the program or the budget, it's also important to see the progress that's being made each month, and whether the same amount of contacts are being realized, or whether it's time to start reshaping the program for the future months ahead. But I think that the $1 million, I think we really got to look at that as part of perhaps the extension, as our CAO also pointed out, rather than just saying we're just going to save it for in case anything else comes up. I don't see this program really function that way. The question I do have, Rosemary, is I know we had to upfront some of the money to the nonprofits because they didn't have the cash flow to be able to make payroll and make other expenses. So have we fronted money yet that perhaps to the nonprofits that have not been expended yet? So we're not capturing a full and accurate report of all the expenditures at this time? Or is there some money still sitting in accounts at nonprofits that have still yet to be expended?
Supervisor, that's a great question, and Michael can expand on that as well. But the funding has been fronted to the organizations as you described, and we are asking for expenditure reports to come up soon. I know that some of them some have been at it for a little bit longer than others. So we want to be able to also come back to you, not just with the fuller report as Supervisor Lopez described as well, but also with an update that includes where each organization is on their expenditures.
Great, exactly what I wanted to get at. So if we could get that, that would also help us have a more, be able to make a more informed decision about the total amount spent, because obviously we might get a report back that there's still hundreds of more $1,000s that have not been expended, because I do realize that we fronted the money and then it took some time to find the right people, train them, and get them up and running to function as a CHW. So anyway, so look forward to getting that report from you. Thank you.
Thank you. We will, I think some really good feedback from my colleagues on the board. We'll take this out to public comment. Anyone public comment? If you're on Zoom, please raise your hand so that I can call on you. I am not seeing any public comment, so we will close public comment. Oh, I do see Andrea Manzo. Andrea, thank you for joining us. We'll put 90 seconds on the clock for you. Thanks for your comments.
Thank you. Andrea Manzo, Building Healthy Communities. I think I was as a panelist because I was a speaker yesterday, so I was on the wrong side. But just want to reiterate that all of us are working really hard on the Be That project to be able to communicate back the great work that's happening. And, as one of the folks that really advocated for this project, believe in the transparency around how the funds are being used, and really being one of those folks keeping the rest of my colleagues accountable to the vision and mission of this project. And so looking forward to what that looks like, and just want to reiterate, the extent of the program, at least for the 6 months that we said, folks have been hired to do that, and really valuing the comment around Dan that we don't know what the future will look like. And so being really well prepared is in our best interest, right? And so looking forward to communicating back the work that's happening and seeing the impact in our community. Thank you.
Thank you very much, and we're happy to have you join us on either the panelist side or the attendee side, Andrea. Thank you. Seeing no further public comment, I'll close public comment, bring it back to the board. There is a request for action, and I'd be happy to entertain a motion.
There's two pieces, and I'll see what my colleagues think of this, but I do approve the first portion, which was readjusting some of those line items to cover the deficits that Rosemary addressed at the beginning of her meeting. I'm not sure on the contingency whether we should agree to that part at this point.
So that's a motion for, it looks like item B on the staff recommendation without C or D.
Yes.
I'll second that. I share the concern about contingency without further direction from us or the CAO's office looking at that. So but I'll second the motion. So.
No, that's what I had suggested at the beginning of this. So,
okay, so we have a motion and a second for to approve the staff recommendation item B and C, which is approving the proposed reallocation of funding as described in attachment A for VITA in accordance with the budget categories and line items previously approved by the Board of Supervisors on December 21st. And I'm sorry, and not C, which would be the allocation of any remaining funds following the proposed reallocation of county funding as contingency funds. So just item B is what the motion is for. Is that correct, Supervisor Alejo?
Yes.
Okay, and we have a second from Supervisor Phillips. So we will. I would be inclined to move forward with allowing the moving around of funds and possibly asking the Community Foundation to look at those contingency funds as part of the testing strategy. However, it sounds like I'm in the minority with my colleagues, so we'll ask for a roll call vote.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Lopez?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Root Askew.
No. So we have a 4-1, but the motion carries. Thank you for the presentation and the information. And it sounds like there's some additional information that would be requested in the future. So if we could see that returned to the board, that would be fabulous. Okay. We are now moving on to the reason that we called this meeting today, which was our workshop on homelessness. Item number 3 is a briefing and update on homelessness in Monterey County, including an overview, definition, current strategies, and identifying barriers to ending homelessness. We have a verbal report, and we will be asking for some direction to staff on next steps. We staff has prepared what is being timelined out as a 2.5-hour presentation. I will just ask folks to keep an eye on the clock. We did have a long meeting yesterday, and I know folks are feeling tired today, but this is a very important subject, and we do want to make sure that we give it due time and process, and that we do allow for the board to share thoughts and give appropriate direction. So I'm going to introduce our CAO, Charles McKee, to kick us off and get us started. Thanks, Charles.
Yeah, thank you, Madam Chair. I appreciate the opportunity to kick this off because the issue of people experience homelessness, those who are unhoused, the challenges associated therewith, is something that is obviously, significant across the country and no more significant than places like Monterey County. Those challenges are very hard to overcome for a lot of people. And one of the things that when I became the CAO, the County Administrative Officer, it was pretty quickly obvious to me that I didn't have a full understanding of all the challenges that are out there, let alone the resources that are out there and all the different pieces that the various players are putting forward. I mean, there's some great efforts going on, and I keep hearing about them. I keep hearing about this tool, that tool, this strategy, that strategy. There's so many organizations. There's so many acronyms. There are so many abbreviations. It's hard to keep up with all the different pieces. And I just thought it would be important for me, as well as the board and the community, to understand the breadth of the challenge and also the breadth of all the efforts that go into meeting the challenge of helping those people who are experiencing homelessness or don't have housing. And I noticed in some of the bigger jurisdictions, they actually have separate departments that have been created just to address homelessness and housing and housing challenges and people experiencing homelessness. And it's something that brought to mind to me that we need to make sure that we're having a coordinated effort to address these issues the best we can. So, I'll turn it back over to you, but I know that we have a great team. We have great collaboration between, the health department, social services, the housing folks at Housing Community Development, as well as our outside partners, the coalition and the leadership council. All of those play such an important role. We also have all the cities in Monterey County that play a big role too, and in the future we're gonna bring them into the conversation a little more in depth. So I want to turn it back over to you, Chair Askew. I hope we can get a great education today. I know Lauren Swanspa is going to start, and she's done a great job with Nick and Roxanne Wilson to kind of organize this, and I know they'll do a great presentation. So thank you.
Thank you, Charles. With that, I'd like to introduce Nick Chulos, our Assistant CAO, to get us started.
Thank you very much, Madam Chair. We're really pleased to be before you today for this really important workshop. As Charles indicated, homeless issues, as I don't have to tell the board, are really significant for us all, and it's a major area of concern. And we want to make sure we do a really good job with this. Today's workshop, I want to just give a few quick overview comments. We have about an hour-long PowerPoint presentation plan. So our goal today is to give as much foundational and baseline information for the board and the public so that there's a really good understanding of sort of the lay of the land, if you want to call it that. And this is envisioned to be probably the first of what will be several workshops that we'll be bringing before the board. And we can talk more about the process a little bit later. But about an hour-long presentation. We have a lot of material to get through, and all of the presenters have indicated that they will be very brief on their portions of it so we can get through all this. I want to thank some staff members as we get started here. The really heavy lifting to put this together was done by the following individuals. And you'll be hearing from them today. Lauren Suansapa from Department of Social Services, Michael Lissman from Behavioral Health, Patricia Zarunian from the Health Department, Melanie Beretti and Anastasia Wyatt from Housing and Community Development, Roxanne Wilson from the Coalition of Homeless Service Providers, and also you'll be hearing from today Lori Medina, the Director of Social Services, Elsa Jimenez, the Health Director, Donna Smith from Monterey County Office of Education, Chief Thornburg and Commander Smith from the Sheriff's Office, and we have on standby, he's not a presenter, but in case there are legal questions that come up, Bill Litt from County Council. And so our thought on this, if the chair is agreeable to this, would be to, as best we can, get through the first hour of presentation and perhaps save the question and answer until after that, because there's a lot of material to get through. And with those introductory comments, Madam Chair, I would turn it back over to you. And we have the first slide. Actually, the first slide is for your welcoming comments.
Wow, look at that.
Okay.
Okay. Well, I just want to, Nick, I think you mentioned all the names of folks that, am I not? Oh, we're not on. We are on?
No, you're on. You're good.
Okay, very good. Okay, thank you.
Right.
So the issue of homelessness is one of those things that I think is deeply concerning to the community. And trying to understand sort of this unpeeling of the onion in terms of who's responsible, who has funding, who's doing what, to address these concerns and to make sure that everyone in our community has a safe and legal place to sleep is complicated, and there isn't a very clear, straightforward answer. And so one of the things that I asked early on Nick and our county staff to do was to host a workshop where we could have an opportunity to learn together a little bit more about sort of the bigger picture of what are the things that we need to, what is the scope of the challenge, what are some of the paths forward, who is responsible, how do we as a county take a role that brings our cities and welcomes our cities as partners into being parts of the solution, and collectively what do we need to be asking the state and federal government for additional assistance with. So I just want to say thank you. I'm excited to learn with everyone today and hope that we can use this as a first step towards how we continue this conversation with our city partners and our federal and state resources as well. So thank you.
Thank you, Chair.
Pass it back to you, Nick.
Okay, thank you, Chair Askew, very much. I'm going to briefly go over the agenda here today. So we have the following items of major organization. The first will be a discussion of organizational structure and coordination of services, how that's done. There'll be a section on defining homelessness, another section looking at current strategies to end homelessness, and another one on types of housing and shelters, a next item on identifying barriers to ending homelessness, and then at the end we'll ask the board to give us direction and talk about next steps. And we have some suggestions, but we really would appreciate the board's input on that. So if I could have the next slide. The next section is the organizational structure and coordination of services, and we're going to be hearing in this order from Lori Medina, the Social Services Director, Elsa Jimenez, the Health Department Director, Michael Lissman, the Deputy Director of Behavioral Health, Melanie Beretti from Housing and Community Development, Roxanne Wilson from the Coalition of Homeless Service Providers and Continuum of Care, and then Supervisor Luis Alejo, who's the co-chair of the Leadership Council. So if we could have the next slide, and I'll turn it over to the presenters at this point. So Lori, you're up next.
Yes. Good afternoon, everyone. And I promised to be brief, but social services is one of the many partners that works on issues around services for individuals who may not be housed or maybe are vulnerable. And so when people think of social services, a lot of times they think of some of the other services that we are providing in terms of public benefits, cash aid, CalFresh. We've got services that are focused on youth and for those who are aging. But then a large piece of the work that we're doing with a very small team is really around some of these gap services for individuals who might be experiencing homelessness or who are unhoused or who are teetering on the verge of that. And so we do that either through direct services, but we also do it through working with our funded partners to either provide support, funding, and other services. We contract with our community partners to provide services. So a lot of the things that we help support are things like the various homeless shelters throughout our community. We have a new center that is opening up, that will be opening up in the next few months, the Share Center, Casa de Noche Buena, which is our services on the peninsula side. There are youth programs like Safe Place, drop-in centers in Chinatown through Dorothy's Place. We've got the Gathering for Women and transitional housing through Pueblo Del Mar. So there's a variety and array of services. In addition, we also work with the Coalition of Homeless Services to really do coordinated entries so that we have housing supports and providing entry into rapid rehousing services. And so all of these things are areas where social services is working with our community providers to support the needs of some of our most vulnerable populations. And so with that, I will turn it over to the next speaker.
Great. Good afternoon. Elsa Jimenez, the Director of the Monterey County Health Department. I mean, in a nutshell, all of the services that the health department makes available to its residents are also available to our unsheltered residents. You know, we serve as their primary care provider. We ensure we have pre-hospital care to be able to transport them in an emergency to a local hospital. If needed and as deemed by the court, we become their public conservator, ensuring that their assets are safe and ensuring that they have appropriate medical care provided to them, housing, food, etc. If needed, and a homeless individual is no longer able to care for their pet, you know, we house and shelter their loved pets while they're unavailable. And then lastly, what I'll point here is that, you know, we conduct health and safety inspections at some of our encampments. We conduct regular weekly visits of Chinatown just to ensure that the garbage isn't accumulating, that it's being cleaned, and that if sanitary services are being made available, that they're maintained in a safe manner. And then lastly, we serve as their behavioral health provider and also help to coordinate their care, which will be discussed in more detail by my colleagues, Michael Lissman and Patricia Zaronian.
Good afternoon, everyone.
Thank you. Sorry, Michael or Melanie or Michael, whoever is up next. We just crashed in our IT room, so we need to take a short IT break so that we can continue with our live stream and recording activities. We do have people watching remotely. So if we could reconvene at 3:10, we can continue. That'll give us a chance to address our IT challenges. My apologies. the interruption. We are back up and running again. So let's go ahead and pick us up where we left off. I think it was Michael presenting.
Thank you, Chair Root.
Okay.
Hopefully everyone had an opportunity to stretch their legs and take a deep breath. It's good to have a Zoom break once in a while. So good afternoon, everyone. The Behavioral Health Bureau acts as the safety net for adults, transitional age youth, children, and families with serious mental illness and mental health conditions throughout Monterey County. We have 3 divisions within behavioral health. The access system of care is our front door, which the community can reach through our 800 number you see on the slide. And that provides information referrals to any of our services, as well as other resources in the community. We have clinics located regionally throughout Monterey County in Salinas, Marina, Soledad, and King City, where we have our access services available to the public. The adult system of care is also co-located at each of these sites, and in those sites, we serve adults with serious mental illness. The children's system of care provides extensive services in schools throughout the county, as well as in clinic sites in several locations, also in juvenile hall. Each of our divisions collaborate extensively with numerous community partners to provide all of our services. We also provide mental health trainings and educational programs for the community. Last year, we served over 13,000 unique individuals, and we've seen an increase of 25% over the past 5 years and 69% over the past 10 years. In this last year, we served approximately 600 homeless in all of our different age groups. Next slide.
Hi, this is Melanie Beretti with the Housing and Community Development Department. Thank you for having us today. So in September of 2020, just last year, the housing team came over and joined the former Resource Management Agency, what is now the Housing and Community Development Department. With that transition, the housing team is small. We have, there was a staff of 4, well, 5, including administrative support, a staff of 5 that came over for the housing team to the HCD, and we're working to fully integrate the housing team into our HCD operations so that we can better support that team and the housing programs to serve the community. We have, within the HCD, we have kind of 3 main areas that we work with to help provide for housing, to help prevent homelessness, as well as help provide resources towards addressing homelessness. So for housing development, we as a department oversee and issue the land use entitlements and permitting. And that is for any of the housing projects, including any projects that would be, including shelters or any physical structures that would be constructed within the unincorporated areas. The county has its general plan and zoning policies that really govern land use and help determine and establish where housing can and will be built. And then, of course, particularly to affordable housing, we have our housing element and inclusionary housing ordinance. However, where especially addressing homelessness, where the rubber really hits the road for our team is looking at, in particular, the state and federal funding resources that are available. So I look at we're really the Housing and Community Development Department is the hub for a number of state and federal funding resources. We have about $1.3 million in community development block grant funds that are available every year for public service and facilities that are awarded through subrecipient grants. We're constantly collaborating and working with our partners, both within the county as well as with our partners within the county team, as well as outside of the county, our external partners, to identify and secure funding for homelessness and emergency housing funding. Also with a focus on securing Joe Sterna farm worker housing to address the very large seasonal worker and year-round workers that we have to provide for our agricultural operations. And then we're also partners to the continuum of care for providing for homeless solutions and programs, and also work to help bring forward and facilitate the development of homeless shelters and housing programs to ensure housing outcomes and addressing homelessness. So it's very variable. I look at a lot of what I see our team doing, and I'll give kudos to Anastasia Wyatt, who you'll hear from later. In particular, is really almost, in a lot of ways, fund wrangling and partnership wrangling, kind of pulling all these pieces together and really collaborating closely with all of our partners to help make this work happen. So I'll hand it to the next speaker.
Hi, I am Roxanne Wilson. I'm the Executive Officer of the Coalition of Homeless Services Providers. The coalition was originally formed to oversee the forward land acquisition and transfer to the homeless services providers. So many of you may be familiar with Pueblo Del Mar, Community Homeless Solutions, Veterans Transition Centers. All of those properties were a part of that transition. Currently, the Coalition of Homeless Services Providers has 22 nonprofit homeless services agencies and 6 advisors, including the County of Monterey, the Department of Veteran Affairs, the City of Salinas. About a decade ago, the coalition had taken on the Continuum of Care program, overseeing the collaborative application and also being the administrative entity of the Continuum of Care. And the Continuum of Care program was authorized under the McKinney-Vento Act originally and then reauthorized under the Hearth Act. I will pass it to Supervisor Alejo now, as he is the co-chair of the Continuum of Care's Leadership Council.
Thank you, Roxanne, and thank you for your work. And for those in the community that are not familiar with this Continuum of Care, these COCs exist all over the state, usually 2-3 counties, but we're in the Monterey County and San Benito County Continuum of Care. So these COCs are designed to promote a community-wide commitment to the goal of ending homelessness. They provide funding to nonprofits. They promote the goals to rehouse individuals rapidly and also minimizing the trauma and dislocation of homeless persons, but also really promoting the utilization of programs and optimizing self-sufficiency. Prior to I being the chair, and now my co-chair is San Juan Bautista Councilmember Cesar Flores, but prior to that, our supervisor, Chris Lopez, as a staff, was serving as chair for some time when he worked for Supervisor Simon Salinas. I wanted to acknowledge his previous leadership. But it's been changed since then. We've added more elected officials from San Benito and Monterey counties, so that there's more accountability and more decision makers at the table. We've also enhanced some more county staff who are experts in these areas, and also some additional community and nonprofit partners. But listed are just some of the main components of the work that we do. We are responsible for collecting and analyzing and then reporting on homeless data to Congress for our region. Once every 2 years, we also do a homeless point in time count. That is critical because that is used for funding as part of their formula. We were able to push that off till next year, as we were due this year, but because of the pandemic, we were given that flexibility. We also set policies for homeless service provisions. We make final approvals of funding under several state and federal programs. They have to be approved by our leadership council. And we also do collaborative application and coordinate homeless services. But also, very importantly, and we're redoing this now, is working on our 10-year plan to end homelessness. And I think we're in the process of having a more effective plan to have a plan that will help us better address these goals within both counties as well. But I will tell you, when I first started, these meetings were very rarely attended by anyone, as Chris would attest. But now we have active participation, and especially with state and more state and federal funding, we have a lot more people at the table and resources to carry out many of these projects, services, and goals. I'll pass it back to Roxanne.
Thank you, Supervisor Alejo, and thank you to the previous presenters. We'd like to now get into digging a little deeper into the discussion in terms of defining homelessness in Monterey County. And for that, we're going to turn to Roxanne Wilson from the Coalition and Donna Smith from the Monterey County Office of Education. So Roxanne?
Thank you so much. So many people do ask us all of the time to make, well, they bring up the McKinney-Vento definition often. So we are intentional in making sure that Donna Smith, who represents the Monterey County Office of Education, is here to explain the difference of the definition of homelessness that the continuum uses versus the definition of homelessness that the MCOE uses. But in general, there are 4 categories that HUD defines. One is really people who are living literally homeless. They are in places not meant for human habitation or in emergency shelters, and or they've been residing in some institution for less than 90 days. The second category are people who are at imminent risk of losing their homes. So those are generally people who are 2 weeks out from losing their current places of residence. And the fourth category is those who are fleeing domestic violence. I think many people fail to realize that if someone is fleeing domestic violence, they do in fact qualify for homeless services, and in some cases are prioritized for homeless services for obvious reasons. The third category, often referred to as category 3, is the other definitions of homelessness, which Donna is going to talk about now.
Hi, good afternoon. So under McKinney-Vento Homeless Assistance Act and Every Student Succeeds Act, it is mandated that every school district and charter school in the United States have an ongoing way of identifying children and youth, including unaccompanied homeless youth who are experiencing homelessness. And this includes any students who lack a fixed, regular, or adequate nighttime residence. And these include, under the McKinney-Vento federal law, shared housing due to economic hardship or a loss of housing, students, families living in cars or parks, RVs, campsites, hotels or motels, even living in a homeless shelter or transitional housing. Those students qualify under McKinney-Vento as experiencing homelessness and are served. Living in a residence with inadequate facilities, living in encampments or on the streets, living in sheds or unconverted garages, and of course our unaccompanied homeless minors all qualify for services in the school districts and charter schools under McKinney-Vento. Once the students are identified through a housing questionnaire and staff members, laws mandate that specific services and resources are given to these students on a regular basis in order to serve their needs, as well as promote their academic success. Next slide.
Thank you. As Supervisor Alejo mentioned earlier, the Continuum of Care is charged with hosting the biennial point in time count. This is, of course, a Continuum of Care requirement, which takes place the last 10 days of the odd years. As Supervisor Alejo had mentioned, we did have to cancel the 2021 unsheltered count because during that time we were really struggling with COVID positives in our community, and we just had to make the decision to protect those who would help us. In general, it takes about 250 volunteers for us to pull this off. The unsheltered count is we use a blitz count methodology, which means we hit the streets around 4:30, 5 o'clock in the morning, all at the same exact time across Monterey and San Benito County. And it's usually a visual count. In days to follow, the coalition works with people who are living unsheltered. We do hire them to go into the community and do surveys. And those surveys help us formulate the percentages of the demographics, which you'll get a snapshot on. I believe it's the next slide. But in 2020, at the beginning of 2020, excuse me, we had worked with a company called Esri for us to start mapping encampments. And during the original map process, it was because of the 10-year the decennial census. So we were already working on trying to establish where people were who are living unsheltered. And then we were going to use that same exact map to help us do a better count this year. We are currently tracking youth, veterans, families, and unaccompanied adults, and we report on those to the federal government. However, this past year, we were starting to incorporate other questions that were supposed to be asked during the surveys, including, are you a farm worker? Are you a college student? And things of that sort. During the last 4 months of this year, we will start planning the count next year. And then we will have to do it again in 2023. And then we'll go back into the odd years. But I do want to just take a moment to say this is a snapshot. It is not a perfect methodology. It is the methodology in which HUD presents as an option. Just to put it into perspective, actually, if we can change the slides, I think that would be a good segue. Yes. So as you can see, in 2019, we counted 2,422 individuals who are currently experiencing homelessness. But the continuum of care also hosts a database called the Homeless Management Information System, and we track how many people are actually being served. And during the same year, 2019, we had served almost double the amount of people that we counted. So also, to put it into perspective, we get funding based off of that 2,422 number. So we've been serving double the number of people with about half of the money in the past couple of years. So the service provider network is under a lot of pressure trying to make do with what they have while serving, like I said, double the population that they're funded to actually serve. Also in this slide, just a couple of quick little tidbits. There are 14% of the people who were identified as being under the age of 18. And then 14% also who were identified as being what's called transitional age youth. So that's 18 to 24. And then 72% of the population that was counted at that time was over the age of 25. You'll also see that there is a gigantic difference between the males and the females. During this particular point in time count, we did count all genders, but there was no one who reported being a gender that is not male or female. As you can see, veteran homelessness also was at 172. There was a decrease. We do expect that there might be an increase this year for several reasons outside of our control. Chronic homeless individuals is 562. But also in HMIS, we served about 800 that year. Next slide.
Roxanne, before you leave that slide, I think one thing to point out, and I don't know that you mentioned this, but is right in the center of that slide is the residents prior to homelessness, 78%. That's an area where I think the public has generally a misunderstanding of where our homeless population comes from. And I think that's important to note. So sorry, Roxanne, please go ahead.
No, thank you, Nick. You are correct. I think people should be aware that we are talking about our longtime residents, for the most part, that are landing on the streets. This is not people who are coming here from the outside in general. Also, the lovely topic of, well, let me just say this. It's no secret that we're starting to identify more and more encampments in Monterey County. As I mentioned earlier, we have been mapping for the past year using the CHE outreach team. Actually, all of the outreach teams that are in Monterey County are actively helping us collect this information and identifying where these maps are. Because the county authorized the coalition to redirect some of our CARES money to build up an outreach team, for the first time ever in Monterey County, we have a countywide outreach team, which I do believe all of the supervisors have had some sort of experience with at this point. If you do have any constituents, or this is also to the public, if you've identified an encampment of individuals who are living in in places not meant for human habitation, and you want to request that an outreach team be deployed to them, you can go to our website, chsp.org/outreach, fill out a very simple form. If you are able to upload pictures always help us identify, how, you know, the velocity of the situation. But it's not going to be easy. And I also do want to just say that as long as there's nowhere for people to go, as long as there's not enough permanent supportive housing in this community or transitional housing, we are going to continue having to try to meet people where they are and provide services like in encampments. Next slide.
Thank you, Roxanne. And one quick comment on the outreach team. As Roxanne indicated, we've had experience working with the outreach team over the past year, and they've done a really outstanding job of connecting with some of the homeless, really assessing their needs and attempting to provide assistance. So in terms of current strategies to end homelessness, our next section, I'd like to invite the following presenters in this order. Lauren Suwansipa from Department of Social Services, Michael Lissman from Behavioral Health, Patricia Zarunian from the Health Department, Chief Thornburg and Commander Smith from the Sheriff's Office, and Anastasia Wyatt from Housing and Community Development. So Lauren, I'll turn it over to you.
Thank you, Nick. I'm going to talk about prevention and rapid rehousing. Really, when anyone starts to ask about what are some of the best practices for addressing homelessness, prevention and rapid rehousing are really going to be at the top of that list. For one, prevention is simply better than trying to find a cure. Prevention interventions can come in the form of housing subsidies, especially those that offer deep and permanent assistance that can address the high cost of housing, and eviction prevention and supportive services that help maintain that housing. In Monterey County, that looks like our family stabilization program that's offered through our CalWorks program at Social Services, rental assistance programs like the one happening now, administered under United Way, and tenant landlord counseling that coordinated through Echo Housing through HCD. The other piece, rapid rehousing, this is the gold standard really, and the most widely supported intervention across current state and federal organizations. Rapid rehousing is an intervention that aims to provide really intensive services that support or reduce the amount of time any individual or family remains homeless. So some of the core components of rapid rehousing are seeking and identifying those potential units, supporting that application process, providing the direct financial assistance needed to move in. And that's not just first, last, and deposit. That's also the many expenses that go into clearing the barriers and being able to move in. So licensing and spay neutering your pets, paying for the credit reports required to get in, clearing arrears, or even buying a bed that they can sleep on when they move in. On top of all of those services, it's really intensive case management. This is intended to be that motivator, that advocate, that support system that can help somebody navigate really the labyrinth of homelessness and help move them straight into permanent housing without, or at least with as few transitional steps as possible. In Monterey County, rapid rehousing programs look like our housing support program offered through the Housing Resource Center and our CalWorks program, the Housing Disability Advocacy Program for seniors, disabled individuals, our innovative, our WINSEE program, and as well as the new navigation centers that are coming online in our community and what they're going to do, the Share Center in Casa de Noche Buena, which we're going to talk about a little bit more in another section. But I'm going to also turn to Michael Lissman to discuss some of the other strategies.
Thanks, Lauren. Trying to, okay, here we go. Yeah, thanks, Lauren. The adult system of care provides a wide range of intensive case management and therapeutic services to adults with serious mental illness. Many of these adults have co-occurring substance use disorders, are homeless or at risk of homelessness, also have trauma, and many have primary care impairments as well. And we provide these services in close collaboration with our community partners. Staff in each of our clinics provide extensive outreach and engagement services with clients in the community, and many additional services at the clinics as well. Most of our services are voluntary. So the following are many of the services that clients can choose to receive through the adult system of care. Case management, as well as individual and group therapy, crisis stabilization, substance use recovery services that are both residential and outpatient, permanent and transitional housing, as well as housing retention services, medication management, primary care integration services, employment and education support services, peer and family support. We also have an extensive array of collaborative courts and diversion services that we collaborate together with probation, parole, and our law enforcement partners in the courts throughout the county. We also have mobile crisis and youth mobile crisis. And really our purpose is to try to help clients find hope, purpose, and a meaningful role in the community. Next slide. Patricia?
There we go. Is Patricia Zarunian on the call?
She's trying to connect, it looks like.
Okay.
Well, while she's connecting, I'll just add that we served about 2,500 individuals in our adult system of care last year.
Elsa, do you want to?
Yes, Nick, I'm wondering, just in the spirit of keeping this on time, I'll do my best to try to speak to this slide.
Sure, please.
As your board is aware, we were part of the Whole Person Care pilot, which was extended one additional calendar year. And through this pilot, we have been able to work with 10 of our community-based organizations and provide funding to them to be able to help support services for homeless individuals identified and enrolled in the Whole Person Care pilot. To date, we've been able to enroll and serve 731 individuals, and 53% of the clients that have been case managed have been helped into permanent housing, which is a significant metric that we were able to reach in working with these very hard to reach and complex individuals, and a little over half of them getting into permanent housing. What we also saw with the individuals that were served as part of our Whole Person Care pilot is significant reduction in their utilization of the hospital, bed days, emergency department use, and also a significant reduction in their blood pressure scores, as well as their hemoglobin A1C for those that had diabetes. At a future point, your staff will come before your board to provide a more comprehensive overview on CalAIM. Whole Person Care is slated to transition next calendar year as part of the new CalAIM Medi-Cal expansion program. And what will be termed will be an enhanced, complex, and basic high utilizing care for all ages. So again, Whole Person Care-like services will transition to ECM, which will be managed by Central California Alliance for Health as part of our Medi-Cal managed care plan. And so we're in current conversations with them and the other two counties that are part of CCAH to help develop the transition plan, which is due in July, and then with services expected to resume back in January. Again, the ECM services will continue to serve individuals who are currently eligible for a Whole Person Care pilot, but will be expanded to individuals with high complex needs of all ages. I'll hand it back to the next speaker.
Thank you, Elsa.
Good afternoon, Madam Chair, members of the board, and all the others that have joined us today for this important workshop. John Thornburg with the Sheriff's Office to share with you what we have been doing, what we've established, and what we hope to continue to do. Deputy sheriffs, whether we're in North County, whether we're in Carmel Valley, whether we're in South County, have constant contact with those people who unfortunately are in a state of homelessness. And because of this, we recognized this last year, or I mean before that, but in November of last year, we set up the HOST team. For those not familiar, that's our Homeless Outreach Safety Team. And we have done everything we can to partner with our fellow county departments and any nonprofit that works with the county to do everything we can to try to help. The HOST team is made up of, or falls under our Community Services Division, which has a commander and a sergeant. And then we selected 8 deputies from our workforce to work specifically with this group. Now, one of the things that goes on is the deputy sheriffs can tell you where just about every encampment is in Monterey County. We've gotten a few calls from probably a couple of you on this board meeting, asking where the encampments were. Again, whether they're in North County, Carmel Valley, or in South County. So the deputies do. Our team is available, and our number one goal is developing relationships not only with our partners here on this call, but also with the members of the community who are in this unfortunate predicament. They want to develop those relationships where the last thing we are trying to do is lead to any sort of arrest or anything like that, but explain what's going on. So whether we're working out at Lapis Road or in Pajaro or outside the city of Soledad, that's what that team is for. That's why we've established it. And we're here to do everything we possibly can to try to help and support all the agencies and folks involved in this important effort. Thank you.
Good afternoon. I am here to discuss one of the big pieces of this puzzle, which is housing and affordability of housing. And we have tools within our reach, such as our inclusionary housing ordinance, and we can, utilize that ordinance to create deeper affordability within the units that are coming through that ordinance. We also have been working hard to collaborate with nonprofit developers such as EAH Housing, who has worked on the Greenfield Commons projects, which will, within the next year, to bring us our first permanent supportive units within South County. We're working with Interim Inc. for a project in Salinas that will be transitional and permanent supportive housing. We're also working with EAH Housing again with Light Fighter Village and Marina. So we really have worked with trying to take state funds, match with local funds, which is a really important part of moving forward with housing production. So another big task we want to try to work on is getting more housing trust funds and more match for those low-income housing tax credits. We also want to look at voucher programs and trying to increase the number of vouchers that are available to people within the community that are low income and are having a hard time paying their rent. So that's a critical need. Roxanne Wilson, the director from the coalition, and I have been working on looking forward to some new state legislation that might help us create more voucher programs. And so that's really key. And we also are looking at what is extremely low income housing. What does it look like? And sometimes it might mean more density and might be conversion of a hotel, which we recently saw. The city of Salinas applied for the project Home Key through the state and was awarded funding, over $9 million of funding for not just the acquisition of the structure, but there will also be conversion of that structure into permanent supportive units. And one of the key ingredients to some of our affordable, extremely low income housing for that permanent supportive housing is a subsidy to help pay for those wraparound services. And that's what we're really glad to be working with the health department on creating that permanent supportive housing. I know they've been doing it for years, and now we're working together to build more. So these are some of our strategies. I know that temporary shelters, or now we have a new navigation center coming online, the Share Center. We're super excited about that, and we hope to have more exits to permanent housing. We have been seeing less exits to permanent housing in the past with just a shelter model, but we're really trying to change the game here. So if we can get more people out of shelter into permanent housing, that's a win-win for everyone in the community. So those are some of the strategies we're working on. Thank you.
Thank you very much, Roxanne. We'd like to now turn to a little bit more in-depth discussion of the types of housing and shelters. And for that, I'd like to invite Michael Lissman from Behavioral Health, Roxanne Wilson from the Coalition, and Lauren Suwansupa from Department of Social Services. Michael?
Thank you, Nick. So Behavioral Health has been contracting with Interim Inc. to develop and provide services with permanent and transitional housing for adults with serious mental illness in Monterey County for about 45 years. Interim provides extensive outreach and engagement to homeless adults throughout the county in order to help them connect to appropriate services and supports. And they provided a significant amount of supports and services at the Country Inn over this past year. The intent is to assist clients with choosing, getting, and keeping housing. They've been able to develop 261 permanent and transitional housing over the course of this time as we contract with them and find different funding service supports from the state and from the Mental Health Services Act. Additionally, as Anastasia just shared, 17 more units will be under construction starting this year. It's going to be Sunrose Gardens, and hopefully the groundbreaking will be in May. Interim case managers provide the full array of services in these housing units that I previously outlined in our adult system of care description in one of the earlier slides. The picture is of Rock Rose Gardens, and it's one of the more beautiful permanent supported housing units in Marina. Thank you. Next slide.
So transitional housing is an 18 to 24 month intervention that has supportive services, but it's not as intense as permanent supportive housing. The intention of transitional housing really is to get people off on their feet and assist them with housing where they would only pay 30% of their income. They have case managers. The case managers will help them with, problem solving and preparing for them to exit into permanent housing. The issue with what we're dealing with in the continuum of care is that transitional housing is becoming more and more difficult to fund. On a federal level, at least for non-mental health services, the HUD has been really pushing us to transition out of this model, but I think locally we do realize the importance of having transitional housing services, because there really is not a one-size-fits-all solution for assisting those who are living unsheltered. Here you see Pueblo Del Mar, but we have Safe Passage, which is a transitional housing program for youth. There's Women in Transition, also in Marina. There's all of the interim housing that's transitional, and then House of Peace in Salinas. But ultimately, we are seeing the transitional housing units become less and less over time, and because, like I said, it's really hard to get funding for this type of intervention. Next slide.
So I'm going to talk a little bit about emergency housing, which is really not truly a type of housing, more of a shelter, but it is a key tool. While interim and transitional units are not always particularly available on demand, emergency shelters really fill an important need. An emergency or warming shelter model typically offers pretty minimal support, shelter and a meal, and are designed to perform very short-term sheltering solution In the case of warming shelters, they often only operate during certain months of the year as an inclement weather intervention. COVID did make some very significant changes in this area, but it remains a limited resource. I do want to draw to attention a brand new resource that the coalition is putting forth in giving more accessibility to finding about shelter bed availability. The dashboard that they've launched can be found on their website. The link here, but if you navigate to the coalition's website and click through the prompts that you're indicating, I need shelter, you can find access to the beds that are currently available that is being updated daily. And we are working to have more of the shelters participating in that dashboard. So hopefully we'll get more robust. Navigation centers now are really emerging as the new best practice model in which that basic temporary room and board is offered under a very low barrier model, but is also paired with those services to connect the guests to income and public benefits, health services, and ultimately, most importantly, permanent housing. The images here on this slide display the two new resources in our area, the Share Center up on top, that is pending opening next month, and Casa de Noche Buena, which is in Seaside, which is already open. And briefly just touch on Project Room Key, because it's such a an incredible program right now, is a program that emerged as a result of COVID. This program provides non-congregate shelter for the most vulnerable and medically fragile persons experiencing homelessness, and for people who would not otherwise be appropriate to stay in a congregate setting. So I'm going to turn it back to Nick to talk about the next section.
Thank you, Lauren. The next part of this, and we're almost done, Madam Chair, with the staff presentation. I'm going to make a few comments here, and then Roxanne Wilson will make a few comments, and I'll close it out with a wrap-up. If I could get the next slide, Lauren, please. So on this slide, this really represents kind of a consensus opinion of the working group that helped put the presentation together. This isn't particularly necessarily, I'm not the sole author of this. This is really a consensus, and but we all do agree on these issues as barriers that really need to be dealt with at the county level, and then there's another slide on the regional level. But just to talk about the county level in terms of organization and coordination, a couple of things. How do we best focus our efforts? That's a question that we've been mulling over and discussing. And under that, we have down the concept of our group that's working on this and the county group in general, I think, works well together. But what could we do to enhance our coordination and organization? What can we do that can really help with successful navigation and implementation? We feel that we need to pursue and continue to pursue a wide range of strategies to address the variety of aspects of homelessness, of which there are several, as you know. There's data that we need to analyze to help us deal with some of the strategy in terms of information informing our strategies. There could be areas for policy development that would need to be really fleshed out, perhaps at the committee level and then brought back to the board for consideration. A really key item is identifying sustainable long-term funding, because part of the reason we've been able to do so much in the past few years, and it's not that we couldn't do more, but that there's been funding available that wasn't available before, and that's a significant aspect. Another item, is there a better county organizational structure to address this? Right now, we have a number of different departments in the county that have different aspects of the homeless issue. Is there a better way to coordinate and remove any silos that might be there to help facilitate the provision of homeless services? Is there a better way to coordinate interdepartmental activities? And although it's not on the slide, I felt that I ought to add, what can we do to better educate the public so that to the extent that there may be misunderstandings about the homeless population, that can be better communicated to the public in general? Then if I could have the next slide, Lauren. Taking a little broader look at the community beyond strictly the county government level per se, we feel that there's a need for increased work at the regional level. We think the Leadership Council has done a phenomenal job. There's more city involvement now than there has been. We really do feel as a staff group that the more we can get the cities involved, the better, because this is really, it's not just a County of Monterey issue, this is a total county issue, and that includes the 12 cities in Monterey County. Every city has some level of homeless issues, there's no question about it. Is there a need to have increased participation on some of the Leadership Council committees? Would that be helpful? What can we do to better coordinate some of the outreach team efforts? And we think that the Sheriff's Department has done a really good job with their outreach efforts. Is there a way to blend some of the outreach and law enforcement efforts in a real positive way? Housing production and affordable housing in particular is a huge issue. And the reason I bring it up now is it's really more than a county issue. It's really a regional issue, because the type of density of housing production in order to provide affordability is, generally speaking, best provided within the cities. And how can we work better with the cities to provide affordable housing, and also the county do its share, of course. In terms of community participation and input, what can we do to increase participation of the community as we address some of the homeless issues? We think that this workshop today, Madam Chair, was a great first step, and we know you have other steps like this in mind. Great opportunity to do that. And once again, to help bring forward the public, educate the public, and really to get partnership as we work towards solutions here. The last speaker, before we finalize the staff presentation, we'd like to turn it back to Roxanne Wilson to have Roxanne summarize the 10-year plan, which is under preparation now. So Roxanne, do you want to comment on that?
Thanks, Nick. So also under 24 CFR 578, the continuum of care is responsible for having a plan to end or to address homelessness, excuse me. We had one that was formed about 10 years ago, and the county and the city of Salinas worked together on doing a revision in 2019. Well, it was adopted by the Leadership Council in 2019. And that was so the plan could meet the requirements of the No Place Like Home competition, which they did phenomenal with, because as Anastasia pointed out, they received funding for 3 projects in Monterey County. But with there's new models out, there's new best practices out. And on top of that, we've gotten better at collecting data within our community. So last year, the Leadership Council authorized the coalition to work with several Monterey County departments to do a complete overhaul of the 10-year plan. Since then, we've held about 7 public forums with about approximately 100 individuals going to each one of those forums. We've had stakeholder interviews. There was about 30 individuals that were interviewed, and many of them were local politicians. We've done a gaps analysis and systems performance analysis, and we just wrapped up modeling. And we are currently in the final stages of the strategic plan development, which is doing a market analysis and the goal setting and prioritizations. What I failed to put on this slide, so I do apologize, is for those who want to learn more about, or who want to see these analysis and also just keep track of where we are, you can visit our website again at chsp.org/plan-rewrite. Or you can just navigate through the drop downs. But we're really excited about this. We have all the right partners. As I said, many county departments are a part of the team that's leading this, including the city of Salinas and also the county of San Benito. And we do plan on wrapping the 10-year plan rewrite in June 2021, which of course we'll present to the Board of Supervisors once that is all completed. Thank you.
Madam Chair, at this point, this concludes the staff's presentation. I'd like to thank all of our presenters for their efforts in putting together these slides and for their time. I think they're all staying on the line to the extent the board has questions that are specific to them. What we had in mind at this point really is to obviously get questions from the board, but really we'd like to be sure we get direction from the board regarding future workshops. We believe that it would probably be a good idea to refer some of these issues to the Homelessness, Housing, Health and Human Services Committee of the board for fleshing out and then returning back to the board with policy recommendations from that committee to the full board. We would certainly be willing or open to any other suggestions the board has or further direction. So that concludes at least this part of the discussion today. Thank you, Madam Chair.
Great. Thank you so much. You know, there's so much that goes on, and there's so many different pieces of this puzzle, these multiple puzzles. And so having everything kind of presented in one quick summary, at least that begins to get our arms around what are all of the different things that the County of Monterey either has mandated responsibilities to provide for, or is sort of going above and beyond to fill unmet needs. So I think this was a great start. I would love to get some sort of initial feedback, thoughts, comments from the board. And as we think about where we go from here, recognizing that the need is indeed much greater than what the county alone can respond to, I think that the outcome that I would like to be able to sort of move forward would be to figure out how in what ways can the county invite participation and work more collaboratively with our city partners to both identify immediate solutions, right, for people who need beds to sleep in, how we compassionately respond to those living unsheltered, and then on a long-term basis, there really is a lot of work that needs to be done to increase the affordable permanent housing supply that we have in our community. And so in my mind, there are these sort of three different pieces of the puzzle, and I have some thoughts, but I'll pass it around to my colleagues. I see Supervisor Alejo. Maybe you can kick us off. And I think one of the things that would be helpful for me to understand is a little bit more about what work the 4-H committee has been doing and what path you see the 4-H committee being able to take in terms of doing some of this coordination and bringing proposals forward for us to consider.
Thank you, Madam Chair. First of all, on this conversation about homelessness, we've come, I think it's right to point out that we've come a long way just in the last 4 or 5 years, but there's much more to do for sure. But I think when I first became a supervisor, I think it was, and if we look back at what the tense battles and conversations we're having at the time, I think we first needed to build up the political will to address homelessness with a sense of compassion, dignity, and respect for our most vulnerable residents. That took some time to build, especially among elected officials. But we've come far on that point itself. I remember the conversations during a very tense TAMSI board meeting when we were closing the warming shelter there, and the town halls we had for what became the Sheriff's Center, very heated conversations in Salinas. And even an effort by your predecessor, Jane Parker and Mary Adams, when they sent a letter to the different peninsula mayors asking for potential sites to locate a shelter, there was a zero response at that time. But since then, just reflecting on that, since then, we've now have the first year-round shelter for women and children in Seaside. We're about to open the one in Salinas next month that will be year-round and serve more as a navigation center than just a shelter. And then there's a more openness from South County where there wasn't at one point to perhaps do something to serve the homeless residents in South County. So that is critical because once you have the decision makers all seeing that we're willing to take on and do the courageous decisions, and they see other cities, jurisdictions doing it, we all kind of give each other cover, and we're all working towards the same goal rather than shying away or letting the NIMBYism take over and block good ideas from becoming reality. The other good thing is that with the funding, it's really been a driver too. Of course, that's why we have a PAC meeting, because now we have money to fund projects. Any ideas that we bring forward and proposals that come forward, we're actually able to get them off the ground. The city of Salinas, to their credit, also took the lead on the ESG funding, which is another pocket of funding. But that also it also has to get approved by the Leadership Council, but it puts them kind of in a driver's seat too, to basically make recommendations on how they would like to see that money used, and it's several $1 million. So I think that's helped also Salinas be an active participant and another problem solver in terms of addressing the homelessness crisis in Salinas. So from that and the funding, I think we started with some of the basic projects, which was the safety net, the shelters, which we knew that there wasn't enough. We needed a safe place to put people and better serve them, and also the additional funding to support the services as well. So these projects are good milestones. We've done those, but now there's a recognition that we need to start focusing on zoning and siting properties that could actually build more of that permanent supportive housing. We did achieve, the city of Salinas took the lead on the Moongate Plaza in Chinatown. We did the hotel conversion. Housing Authority rebuilt one of its apartments in Chinatown too, from a dilapidated building to something that's very beautiful and dignified for homeless and low-income residents as well. So we need more of those, and those are, as Anastasia pointed out, there's 2 or 3 projects in the pipeline, but they're very expensive to build housing, and that's why the governor has focused on, if we're trying to convert something and achieve these units more quickly, these hotel conversions are a cheaper and faster way of doing it. So if we could find more of those projects in Monterey County and build these other ones, I think that's where the community is going to be able to see in the next 2-3 years. We want to be able to show we got these other projects off the ground, created more permanent supportive housing, so that when we're trying to achieve this rapid rehousing, we have places that are affordable that we could place people into, but also make sure that they stay housed, that they do not return to homelessness at a future date. And that is the goal. So I think we had a conversation in our Health, Housing, and Human Services, Homelessness and Human Services Committee, 4H Committee, but also recently with another committee that we had was talking about what are the county properties that we have throughout the county where we could start looking at those rather than sitting vacant or not being put at use at all. Let's look at those where we could partner with a nonprofit developer, look at getting some of the state money that's coming in these subsequent years to see if we could site those, zone them, and also use those to build more permanent supportive housing. I think there's a realization for our community. We're not going to solve all homelessness overnight, but if we show that we're making good progress every year, every 2 years, that we're achieving these milestones, I think that those victories and those milestones, I think, is what the community wants to see, rather than seeing just a continuing homelessness crisis. They want to see that we're putting places, getting them off the street, putting them in housing, making sure that they have better opportunities and could get back to being able to sustain themselves in future years. And that is my commitment. And I think that is where I think the focus should be from our committee and from the Coalition of Homeless Service Providers and the Leadership Council, that we should be focused on those kind of projects with the resources we will get in the next few years.
Supervisor Phillips?
Yeah, I'd like to echo some of the comments that Supervisor Leo said. In the last 5 or 6 years, I've seen a big change in how we've embraced this. And as Luis mentioned, we were battling with the city and the county. Well, it's your problem. No, it's your problem. And I think we've come a long way in coming together, especially with the Share Center and other ones, but coming together to work together. And I recently we're trying to do something about the people down in the river that were stuck down in the river or staying in the river at Pajaro. And I got to say, I was impressed with the group. Nick Chulis and Charles were involved. The sheriff was, Roxanne Wilson, their group just did an amazing job. Got the veterans, Smith and Enright. It was the sheriff was involved. The fire department was involved. Everybody worked together to provide the right services and try to reach out and provide the services. So I was impressed with the coordination that we're able to do, and whether we can expand that and do better. I'm sure we can, but I was impressed with that. One of the biggest problems, and I think it's important that we keep the trash and the garbage cleaned up around the homeless encampments, because that's what caused such a stigma of why people don't want any of the homeless around. And Luis will remember the battles we went out to the public when we were talking about where we're going to put the share center. And so if we can help provide for the right kind of cleanup and assist the homeless people to keep their places where they're staying cleaner is critical. And I guess I'm a bit of a pessimist in that my years being and dealing with the homeless, there are some of these people that are just not going to come in, and because of the mental problems or drug problems or whatever, but they're not going to come in, and you're not going to be able to work with them. But if you can provide a place, and I thought, and we talked about when we were looking at the problems at Lapis Road, and we were looking about maybe on Fort Ord, a place where you say, well, this is a safe place for you to come and stay, and maybe you provide the bathroom facilities for them, and you have a big trash container, you have the water and the other things there, and you have some degree of supervision, and maybe provide some of the tiny houses there for them. But rather than them staying in Chinatown and then coming and clearing them out and then doing it again, I think but every time you talk about, well, let's have a piece of property here close enough to town, I know Supervisor Parker was talking about maybe we could have a nice place in Toro Park. But the bottom line is a lot of the homeless just aren't going to, they want to stay around the city somewhere. And I've always thought we're one of the things maybe we could do is having 2 or 3 acres where you say, okay, if you need a place to stay, this is a place to be, and you have some supervision of it. But I guess my takeaway point for this is I just think we're doing a hell of a lot better than we did for a long time, where we were always fighting with each other, the city and the county, and I appreciate what you've done over in Seaside and getting that one, and I'm really anxious. In fact, I want to try to get out there tomorrow, maybe see the Share Center. I'm anxious about that. So thank you, Madam Chair.
Thank you, Supervisor Phillips. Supervisor Lopez.
Thank you, Madam Chair. Just wanted to thank everybody. I can share that I've been around the county halls for about a decade, and in that time I was able to serve as the leadership coalition's co-chair. And back then the real vision was we needed more buy-in from elected leadership. We needed more people at the table having conversations. And at the time I was a staff member. And for that reason, I want to thank Supervisor Alejo, because we reformed the entire commission. And he was the first one who kind of walked through the door, having recently been elected to take that on that task. And what they built there and the timing that came together with that funding was really, it's what's put us in a position where we can say that there's a lot more resources in play than have ever been in play before. But it doesn't mean that our challenges are over. The problem continues to grow. And I think how we get through that is through collaboration, by working together. And I think that's what I saw in today's reports. I want to thank everybody who's done that frontline work. I've seen that work undertaken by so many of you, including John Thornburg and everybody from the coalition, Roxanne Wilson, who's reached out. And we've, it's all over the place here in my district now, which wasn't the case just 5-6 years ago. But really leading with compassion and leading with that understanding of we're not trying to put people in cuffs and take people away. And also, as I always like to say, leading with data and knowing that the people that we're dealing with that are in these situations, they are us. They are people from Monterey County whose last residence was here within our borders. And so leading through a lens of compassion and understanding and helping to address the issues that they are facing, specifically talking about how it all ties in through my work on behavioral health. And Michael, listen, thank you for all that you've done and brought to the table and helping to understand the resources and what's available. It takes all of us breaking down those silos and working together. And I know that there's still a lot of misunderstanding with folks who might be dealing with this for the first time. And I mean that by some of our city partners who've never had to deal with sort of the visible nature of homelessness in our county. And it's that continued education collaboration that's going to move us forward. So I appreciate today's sort of covering a little bit of where we are, where we've been, and where we're headed. And always appreciate a deeper dive, but just want to thank everybody's continued efforts in moving us forward as a county. Thank you, Madam Chair.
Thank you, Supervisor Lopez. Supervisor, we'll do Supervisor Adams, Alejo, and then we'll take it out to myself, and then we'll take it out to public comment. So anyone who would like to public comment, if you can queue yourself up with your hand raised, we can get through everyone. But Supervisor Adams.
Thank you, Madam Chair. I'm not going to take a lot of time. I have seen significant changes, both for the good and for the bad, in the field of homelessness in our community and in our county. I've worked on it for so many years, for decades, and I feel like we're making more progress and have made more progress in the last few years than we have for the previous 20 years. I'm very thankful for that. That's the really good side. The downside is that I see homelessness so much more now in the 5th District. I mean, I used to see it down and around in Monterey at some places, but now there are so many places just off on Highway 1 where you see just encampments set up, and it's heartbreaking. And I agree with the previous speakers, but I know from my own experience that the people who we are seeing as homeless now are people who are us. They're our neighbors. They are people who have lived here in our county and in our community for a long, long, long time. And it's very difficult for them, and it's embarrassing for them. And many of them have had no place to turn, and this is the result. One of the things that I'm very pleased about that I know we'll make use of in our office a lot more is the form that the Coalition for Homeless Service Providers has put forward, so that it's not just always having to call, the police. That's not the way to handle this circumstance. And I think that Sheriff Thornburg is a good example of the new approach that I think a lot of law enforcement has toward looking at the people who are homeless as people and putting a name and a face to them rather than this amorphous group called the homeless. I think that has been an important change that we're seeing as well, that we're looking at people far more as people and looking at their problems much more individually, knowing that it's not a one size fits all, that it has to be tailored individually to people. The importance of wraparound services has been there forever. And I'm very thankful for the great work that we're doing now to address all of the issues that we've got. So count me on your side. And Roxanne, I'm just so pleased at the great job that you're doing. Thank you for pulling together the coalition that you have of a lot of county people. It's making a big difference. Thanks.
Thank you, Supervisor Adams. Supervisor Alejo.
Yes, Madam Chair, I just wanted to add just 2 more points. And one was the goals for the future. We do need, and it sounds so simple, but we do need more homelessness champions and advocates among the elected officials. And there was some electeds who were reluctant at first, but now they've become great champions. Among those, the late Mayor Joe Gunter, from when we were having differences to working really closely together, Supervisor Phillips, Mike Labar, Ian Oglesby, who when he joined, really pushed Seaside to take on that shelter. So every opportunity from here forward that we could recognize homelessness champions and movers who are not going to be afraid, who are going to be willing to take tough votes sometimes at the resistance of some vocal residents, because we know that's what it's going to take. And the more of us that there is in Monterey County, the more we could get done when we face political pushback. The other part I wanted to say that with these projects that we do realize, we also have an obligation to make sure that they're managed properly. Whether it's the hotel conversion, whether it's our new share center, the Seaside shelter, we have to make sure that they continue to be success stories, because when we want to do other projects, we want to show the community that when they're managed right, we can serve the community, and there's not going to be all these problems, these stereotypes that are often associated with these kind of projects. We know that was a case of our temporary shelter on West Dallas South. No complaints for the community. We had very little problems that took place there. But when we opened that place, we heard a lot of things that people proclaimed would happen, and they never came true. So I think as we move these projects, that would help us build public trust, knowing that when we do these projects, we could do them right. We can address concerns for the community, and we will not see these allegations that are often raised with serving homeless residents in our county. So I think And again, these sound simple, but they are imperative. They are critical for us to continue to have success in addressing homelessness in our county. Thank you.
Thank you. I think you made some fantastic points. So I just have, and I see, I don't know if it's my Zoom, but I see 2 hands raised on the panelist side, but I don't see anybody with your hands raised. So just pointing out if I'm missing you, it's not intentional. So I think a couple of the points that for me jump out at me, you know, when I look at carefully look at the homeless census, which that data is really valuable. I find myself pulling it up regularly to point out or to provide factual data that counteracts myths about who we think our homeless neighbors are, what their, you know, what led them into homelessness in the first place, what their needs are. But one of the things that I think we talk about the need to have more champions in support of homeless services. And when we look at the number of shelter beds that are currently available in our county, District 4, specifically the single city of Marina, has more shelter beds than the rest of the county combined. And so finding ways that we can continue to build out those champions and supporters in locations that are willing to welcome shelters into their community, finding the elected leaders who are willing to utilize their soft power to identify those potential sites for shelters or for permanent supportive housing, or even for some of the immediate, you know, how do we have a conversation about ensuring that encampments are safe, healthy places for people to live? I think that that's something that we haven't really had that conversation, but it may be time to have that conversation. But when I'm out talking to the community, and there's a narrative that, you know, well, it's the county is responsible for ensuring that everyone, all 3,000 unsheltered individuals, have a safe place to sleep at night. And I don't know that that's necessarily, from what I've been able to understand, the case. And really, we have this need to have the county, the cities, the coalition-funded partners, philanthropic partners all come together to help us map out what our plan is moving forward, and then collectively let our state and federal allies and advocates know where the gaps for funding are. I think the ongoing questions that I have really are sort of more structural and policy related for this board, in terms of how do we commit to doing this work. We have, I think I heard a couple pieces, right? We have a need to talk about what sanctioned encampments might look like in terms of support, litter, sanitation, supervision. I hear that there is a need for additional shelter beds, and the desire to ensure that they're managed well, especially when they're county shelter-funded beds. And then in terms of permanent housing, that there's an opportunity and a need both to identify where county properties may exist, but there's also quite a bit of policy work from our Housing and Community Development Department that needs to be done to ensure that we have removed and are continually removing any barriers to our housing developers who want to be building that type of housing. So I've identified sort of a handful of very key, specific next step action items that I'd like to see us move forward with. But I'll take it out to the public, and then we can come back and have some final wrap-up comments. So for public comment, we have a handful of folks on the phone. I don't have anyone here in board chambers. Is there anyone from the public who wants to add your voice to the conversation today? Share any thoughts? We have some of our homeless service providers on the line. We have some of our city partners on the line. We would love to hear from you. All right, I don't see any hands raised, so I'm going to go ahead and close public comment, bring it back to this board. We could do any final wrap-up comments that folks have, but I think what I would like to propose is that this was a great chance for us to really get our arms around what the county services are provided. I know that there's some ongoing conversations and some work and big projects that we, the county, are working on, that our staff are working on with the city of Salinas in regards to the Share Center and beyond. And I, in conversations with Mayor Craig, there's an interest from the City Council in Salinas to have another joint meeting where we can maybe get an update on the Share Center and map out what we may be able to work on together in terms of identifying properties or additional shared policy work. So we're holding the date of April 27th for that joint Salinas City Council meeting. And then I put out to you all, I know that we have other cities. The city of Seaside is doing quite a bit of work in terms of they've got some parking encampments that they've sanctioned unofficially. They're opening the new shelter. There may be interest in having the city also learn a little bit more about what we're up to, if there's an interest in this board in having those kinds of meetings. So I'm posing that as a question, and I'll start with Supervisor Phillips.
I think that would be an excellent idea. The other thing that I failed to mention is I think we can reach out and do a little bit more on building the tiny houses and build. I know we're building those down at Rancho Cielo, and they have a 400 square foot and a 200 square foot, but I know they're building some for King City or taking them down there. But some people just can't live in a more communal environment like inside the share center, and so this would provide it for the small family or the single person. And I thought that is a good idea, maybe some around the share center or some other location where we do it, but that's something else I think we ought to try to look at. But thank you.
Great. I've added that to my kind of action to-do list here. Thank you, Supervisor Phillips. Supervisor Alejo, and I think one of the questions maybe that I'll throw back at you, Supervisor Alejo, is I don't want us to be duplicating the work that's already being done through the coalition or through the 4-H committee. So if there's ways that you can help us navigate what the board as a whole works on, and then what we're delegating over to those other spaces, that would help me as I try to draft out agendas moving forward.
Madam Chair, I think there is value, though, bringing some of these conversations to the board, because sometimes I'm involved in pieces, Chris, all of us are involved in different pieces at different times, but having these conversations come in an open meeting like this has us have this conversation on the same page. And I agree. I think the real solution to homelessness is more housing, and we need all kinds in Monterey County. And we've talked a lot about having a pilot small homes project in Monterey County somewhere. We talked about it for years. We just haven't done it yet. And I think we need to have at least try it out, see how it works, and learn from it, and see if that's viable for future projects. But I think we haven't had a conversation of when we're looking about housing in Monterey County, where do we envision seeing that happen? And I know the city of Salinas is talking about it, and being a member of LAFCO, as you're an alternate, and Supervisor Lopez is on there. Gonzalez is looking to build housing, significant housing, as is Soledad. That's, I think, when we talk about homelessness and the unaffordability of housing in Monterey County, I think those are the conversations also that add to this. And the community would like to hear it. Where are we going to build housing? How many? How long is it going to take? When are we going to break ground? Those are all questions that I think we could help facilitate and show people that there is a real solution coming. And I think Monterey County, compared to other surrounding counties, has more housing projects in the pipeline that we've been waiting for, but just have taken years to get through permitting and environmental review. And we're still waiting for the groundbreaking on some of those larger projects that I know are being planned for the 101 corridor. So I want that to be also something. In terms of other issues, certainly when we complete the 10-year plan, we'll be talking about it at the Lead Me Home Leadership Council, but certainly bringing that and having a conversation among the Board of Supervisors as well, I think would help us be able to be more active in carrying out those goals. What we don't want with this new document, and we have a new consultant, is for it to be just a plan that sits on the shelves and collects dust. We want it to be an active, a live document that we're actually putting to use and carrying out goals, utilizing the best information we have to best serve our most vulnerable in our county. And so I would just put those two things out. Oh, one last thing was the ADUs was another piece. I filed that referral back in 2017. And I know that's coming. We just heard a report, an update recently in the 4-H committee. But ADUs, it's not the total answer, but a part of the solution to incentivize people utilizing ADUs, having a standard template with perhaps 3 pre-approved architectural plans that would save residents money, but could actually maximize limited land we have in Monterey County to add some more units as part of our portfolio of strategies and answers to address our housing crisis in Monterey County. So that should be coming to the full board pretty soon, but it would be another step in the right direction.
Great, thank you. Got that down as well on our permanent supportive housing piece. Supervisor Lopez.
Yeah, I just want to echo everything Supervisor Alejo said and just add one more piece. There are bright spots. I mean, right now, this week, I think in the last 10 days, over 1,300 beds have come online for farm workers in Monterey County. And I was lucky enough to be down here in Greenfield. When those folks arrived here, they got off the bus and were immediately offered their vaccine. It's that sort of priority for our farm workers as well that helps alleviate the pressure in our communities. So when we talk about all the different moving pieces, there's no silver bullet, but using ADUs, using farm worker housing, and using additional construction where appropriate, we're going to meet our community's expectations. We just have to keep pushing in the same direction. And so I just wanted to add that one bright spot that for me in the last week, I know we're all focused on COVID and the media tends to cover COVID, but great things are happening here within Monterey County. And I'm just excited about the fact that those beds came online this year despite a pandemic.
Yes, Madam Chair, just to Chris's point, in the 4-H committee on just farm worker housing, we have a program that we're trying to formalize in Monterey County for employer-sponsored housing. We have the projects where staff expedited the permits in record time. These projects got built in record time, and they are now open. And Chris just did the unveiling for the one in Greenfield. We just did the visit also at different times of the Salinas farm worker housing project that could house up to 1,100 to 1,200 workers. But we asked staff to formalize a program that we could tout, that we could put out there for other employers saying, we will expedite, we will prioritize and get these permits through the process more quickly if they meet the standards. And the Tanamura and Antle and later Veranda Villas really set the standard. And now these two other projects have built, if not just as good, if not even better. And so we want to be able to model that and tell the world that we have the most beautiful and dignified farm worker housing anywhere in the nation, if not the world. And it's been 100% paid by farmers in Monterey County. So that it will be something that program we will try to formalize and bring to the full board to give it its stamp of approval at a future date as well.
Great. Supervisor Adams, did you have any final wrap-up comments before we close this up? Anything in particular? And I'll just reiterate, I have sort of a list here of sort of immediate, encampment type, safe and legal housing solutions for folks, a shelter bed, sort of intermediate set of items that we need to maybe focus on, and then another list of sort of more policy-specific permanent housing actions that we can maybe look to pursue or delegate back to some committees. Is there anything you'd like to add to my to-do list?
I think I have been just impressed with all of the comments that have been made, and I feel like it's been said, and I would just be reiterating the same thing again. Thank you.
Okay, great, thanks. So I think the only other one that I have on my list would be to add would be the COVIA Home Match Program, which I know this board has been presented, and I think you brought that forward, Supervisor Adams. So it really is sort of this menu of all of the different things, and some of these things really are policy issues. And I would propose that we continue the conversation. I can work with Nick Chulos and the City of Salinas for a next step where we talk about a joint meeting with the city. Do we have a timeline for when the 10-year plan will be ready for debut?
We expect that it will wrap by June 30th of this year.
By June 30th. Okay. So maybe sometime in midsummer then we can find some way to bring in and invite some of our other city partners who have a shared interest in hearing about that and discussing that. And I found this to be very helpful. I really appreciate. I know staff took a lot of time and care in preparing the compilation of resources that are provided by the county. I know that, Nick Chulos, I just want to thank you. I threw this out there, and it took a lot of work to pull it all together, and I've been pushing the timeline. But I really do appreciate being able to have this conversation and how open everyone has been. We do need to find some ways to showcase and celebrate the successes, while at the same time recognizing that the challenges facing our community have really never been greater. At MPUSD, a year ago, we had 10% of our students qualifying as McKinney-Vento homeless. That number has essentially doubled in a year. And those are families who are moving from overcrowded housing into living in vehicles and potentially becoming eligible for the HUD definition of homelessness. And I have to suspect that same movement towards lack of housing is across the board, not just for families with children, but for anyone who's lost income or experienced significant challenges this year. So I think everything that we can do, that the challenges are only going to increase, and our challenge is to race to move faster than the need. Charles, do you have any wrap-up comments, or Nick, do you have any wrap-up comments for us? Or Charles, I'm gonna put you on
Thank you,
the
Madam
spot.
Chair.
Wrap it up for us.
Yeah. Thank you, Madam Chair. I think you actually wrapped it up pretty well, which is, how do we move to the next steps? And I think the next thing on our to-do list is bringing the cities in and working with the cities on how we can both showcase what we're doing as well as get some concrete action plans in place.
Great. With that, we are going to be adjourning this special meeting. We will be reconvening yesterday's regular meeting that was continued to today. We will be recessing that meeting into closed session, and we will plan to adjourn directly out of closed session. And I just want to once again really offer my deepest thanks to each one of our presenters today, not just for your presentation today, but for the work that you're doing day in and day out to meet the needs of our most vulnerable community, friends, neighbors, and loved ones. We see you, we value the work that you're doing, and we're here to look for those policy opportunities where we can best support the work that you see needs to happen in our community. So keep talking to us, let us know what you need, and we're excited and looking forward to continuing working with you. Thank you.